Megan Fox has the story.
Megan Fox.
Megan Fox.
Megan Fox.
Megan Fox. Megan Fox, a national journalist.
Mastodon. I will never be able to say that.
It feels like the Flintstones live there.
It does.
Well, don't trust women. I think you just touched on that with your last. That's what they brought. We're going to have to bring back chaperones.
Jesus, no.
Just careful. Stop! Break! Ooh. Hard right.
How did you screw up a stove, Megan? You're a woman. I thought that was baked into you, like at the genetic level, how to operate kitchen equipment.
And honestly, Megan, if you don't like it, I'm sorry. I've been very nice to you.
You get Dino hanging out outside chewing on a large bone.
I highly recommend being targeted by the New York Times and Rolling Stone for weight loss. And I'd say, keep it coming. I need to lose 20 more. Please, keep it coming.
Explain to me, Megan, why did this country not have a holiday once a year? That's the time you vote. If you don't show up and vote, up your ass. You don't get another chance. You don't get, I don't care if you're in the hospital. Crawl to the stake, crawl there. But that's it, 1 day, 12 hours, and then you're done. And you count them that day, and that night you know who the hell won.
I will eat you alive. You want to tangle? You want to go?
The only thing going through my head is, what are you going to do when Megan Fox runs wild on you, brother?
He made a deal with the devil. She's the devil.
He wants that.
Oh, God. Gross! Oh! All right. Penalty box for Slug. Yep.
Of a mile.
Are you ready to behave yourself now, Slug?
This frustrating rep.
Are you ready to behave yourself? Repossessed puppies. I'm hiding pork chop. ASAP. Have you seen his little pork chop? Oh my God, pork chop is the cutest.
That sounds bad.
Have you seen it?
Pork is pork.
Though you may be tempted, do not contact any person or persons mentioned on this stream. Do not even think about contacting anyone who may be the topic of the daily news. If you should do that, the host will question your IQ, possibly call you names, and mock you for disobeying these basic rules of decency.
All the best.
Well, good morning. Welcome back to the show. I am here. I was here this whole time. We had a little problem with the OBS update. Never, ever, ever hit yes, I want to update this right before you stream because it knocked all my settings out and Super Tips wasn't working. But Brad is an IT, he's an IT goatee god, okay? He just is. And he got it working. And thanks, Rozilla's Realm, for the 5. We can actually play it now.
Don't insult the hair of the mama fox, comparing her to a witness dumber than rocks. The hair frizzed out, worse than a scared cat. Don't mess with the fox while she's wearing the hat.
Encore.
It's like Mary Lankins does Dr. Seuss. I like it. I like it a lot. Thank you, Mary Lankins, for that chat. But yeah, Brad, those of you who are not subscribed to IT Goatee Brad, you need to get over there and subscribe to him because Brad rules. IT Goatee, thank you so much for dropping whatever real work you were doing today to come on here and help me with my computer. God, I will never do that again. I'm never updating OBS again, actually.
Always just remind me later.
Uh-oh, says Priscilla. She's wearing the hat. Yes,
yeah,
well,
I think my computer has still been...
What? Has still been what? Mo?
You kind of...
Did I lose you?
Oh, I was like, I've still been... No, can you hear me?
Yeah, I can hear you. Now. Yeah.
Oh,
no.
Sorry. I was just going to say, I've been Oh, for the love of Cheetos.
Is there a
I've
delay?
been saying no to whatever Microsoft update. No, I think I just hiccuped and then I think there is.
That's weird.
Nice.
Let me
There's a delay.
go out and then come back.
All right, you do that. God, what is it with the tech today?
Nice.
Good Lord.
I'm so glad I'm not the only one with tech issues. I don't feel bad anymore. I don't feel special either, so boo.
All right. Anyway, I guess we're super late, so we might as well get started here. We have a bingo card to go over. There she is. She's back. All right. How is it now?
Good. I can hear you stop and start.
Okay,
Is it
that's
still
good.
on delay?
I don't know. I think it's
we're
okay.
good.
IT Goatee, don't go anywhere. We love you. Come take over my computer.
No, I think you're good now. Well, we'll see. All right, I've got the bingo, and I'm gonna go. We need to go over the new bingo. There's a lot of them. I added more even from last time, you guys. This is the biggest bingo game we've ever done, ever in the history of YouTube's. This is the biggest bingo ever. Are you ready? Because here we go.
Yeah.
Holy cow.
Or we've got sex scandal face. Meg's blood pressure meds stop working. Crap, I got to go take them. For fuck's sake, river dancing, defensive body language, drunk or high witness. The simulation does not disappoint. Judge takes a Werther's break. Spider-Man meme. Megan hates prosecutor. Take his badge. The C word. Free space. Fake words. Osteogenesis imperfecta. Flux is going to get angry. Evasive answers. Lazy investigator. Flux hates prosecutor. Sidebar. Overruled. Megan hits wrong button. State lies. Get squunched. Hair talk. And then we have dumpster moment. Oh, wait. Hold on. Ah, shit. Am I going to have to? I hit the wrong button. You're going to have to already do that. Then we have. Now I'm going to have to read them all over again. Dumpster moment, hair talk, what do you do here? State lies, evasive answers, didn't do nothing. Meg's blood pressure meds stopped working. We could probably just put that up there now. Conflicting testimony, drunk or high witness. Oh, that reminds me. I have an announcement to make about the drunk or high witness. So Dr. Verena Brown, we all had a lot of good laughs about her looking like she was super high on the stand. As I was perusing her TikTok page, well, I have to make a correction if a correction is due. As I was perusing her TikTok page, somebody made a comment that, geez, doctor, you look tired. And she responded and said, yes, that's the way I look because I was born with a muscle problem with my eyelids. So apparently the doctor has an eyelid problem where the muscles in her eyes do not work properly. That does not
also. Does that also slur her speech?
Right. I was also going to say that does not take into consideration why she kept making up words like point cent and variable and also slurring. Okay. However, I will give her that her eye problem, the half closed eyes, could be related to a congenital defect. She was born with some muscle problem with her eyelids. That's her story, and she's sticking to it. And I just, in the interest of fairness, we need to make sure that the whole thing is put out there. So maybe her eyes are not an indicator. But I think her
she
speech
has
pattern.
Jim Brewer-itis. Is that what we're saying? She just suffers from Jim Brewer high eyes. Please tell me it's called slothitis or high-itis.
I forget what it's called, but there is a name. There's a name for it. I just forget what it's called. It's on her TikTok page. So, in the interest of fairness,
use a scrunchie to explain it?
Look, it doesn't make me hate her any less, but it's in the interest of fairness. The audience ought to know she says she has a congenital eye problem, and that's what causes her eyes to look perpetually high. Okay. In fact, she even told the person on TikTok, people think I look high all the time. So this is a common problem.
That's what somebody high all the time would say.
Yeah, that's what Jim Brewer always says. Like, I'm not actually a weed head. I just look high. And of course, he's Jim Brewer.
All right. Well, you take that information and do with what you want with it. Okay. Megan snorts. The simulation does not disappoint. River dancing free. Sidebar. Flux hates prosecutor. Appropriate. Loving parents. What a bitch. Judge takes a Werther's break. Fake words. Blink rate anomaly. Defensive body language. The C word gets squunched. Sex scandal face. Spider-Man meme. And the extra squares are thug judge, Megan hates prosecutor, overruled, sustained, lazy investigator, Flux is going to get angry, muted boomer, bird talk, invade Canada, they're making shit up, Megan hits the wrong button, which if you have that on your bingo card, I think you could definitely check that off this morning. Witch sighting, perjury, unknown significance, osteogenesis imperfecta, bendy babies, AI portion of show, weird mouth noises, Flux pets cat, Carrie's dad smoker's cough, take his badge, for fuck's sake, unfucking real, what if anything, awkward pause. Okay, that's it. That's a big bingo card, folks. That's what she said. All right, let's see. I got to generate mine and we got to start. Let's see. I can do free space. Do I have Megan hits wrong button? I do. All right. I get to turn that off. So, all right. So that's where we're at. We've got free space and Megan hits wrong button. Okay. Another thing we need to discuss is today is Dr. Stephen Messner. Jennifer, why don't you give us the rundown real quick? Who is Dr. Stephen Messner while I run to the other room and I'll be right back.
Okay. So Dr. Stephen Messner is one of the main CAPs, child abuse pediatricians at CHOA, Children's Healthcare of Atlanta. And they love to, whoever does the accusing on one of the families, they love to call one of their own in to just sign off and to agree. Now I realize in healthcare, sometimes you do need that someone to come in and give a second opinion. They don't really do that. They don't go over and have their own exam with the child. They don't actually go and talk to the parents. They just sign off on whatever, their colleague does. He is extremely cocky. He's extremely arrogant. He can do no wrong. He testifies a lot for these cases. They put him into a lot of trials. I don't think anyone's really going to like him. He thinks he's a smooth talker. He's really just a jerk. In fact, let me tell you what he did, you guys. The Timms trial started March 3rd, okay? Ended the first week of April 4th. It ended April 3rd. So it ended then. The Hernandez trial started May 12th. Stephen Messner testified in both of these trials. When he testified against the Hernandez family in May, Carrie was there that day, sitting in the gallery to support her friends. He stopped after testifying, stopped in front of her and said, well, hey, directly to Carrie. It's just smug and gross. He's just smug and cocky.
Yeah. Why would he do that?
They lost that trial, but he knows that they still won by taking her baby away for 3 years. So in a way, even when the families get reunited, he knows how much damage he caused. He knows that.
Well, that's really gross. I hate that very much. And I'm sure I'm going to hate this witness. He looks very smug, by the way. Smug is a good way to describe him.
And when he answers some of the questions, you're like, sir, seriously? Like, he will tell you he does no wrong. Jen the Couch wants to know how many child abuse pediatricians are at CHOA. There's been 5 in the state of Georgia. 4 were at CHOA. 1 was at a Children's Healthcare in Atlanta. But there are some fellows. A lot of these fellows come in and they do training under these CAPs, and they can still make diagnosis. Some of our families we support, they were accused by a fellow, somebody who doesn't even have their license in this made-up field to begin with. So it's hard to say, but there's less than 400 child abuse pediatricians nationwide. So there's not very many. And they're all part of the Helfer Society, if you want to dig deep into that scary mess.
Yeah, the Helfer Society is really something we should talk about one of these days.
Yes.
Just checking in on the fundraiser.
We are the Hellforce Society. What?
Yeah, I know. Hellfire. It almost sounds like Hellfire.
Who wants to belong to the Hell Society?
This is also like Operation Stamp Out. Would someone please run these names through marketing? Get me in there as your consultant. This sounds hella bad if you're trying not to be the bad guys.
I know. The Satanism is everywhere, though. Checking in on Carrie's and Brady's fundraiser. We're at $4,100, you guys. $4,131. 46% of the way there. We are 46% of the way to river dancing. Okay, ladies, get your prom dresses now. You're going to need them. Yes, Flux?
The dress that I'm wearing, it's a bridesmaid's dress, right? So the wedding's this weekend.
Perfect.
So I'm gonna get the filming done this weekend because the wedding's this weekend. So I'll be all done up and
perfect.
We're shooting for this weekend.
All right. The chat has pointed out that I snorted. So Megan snorts. You can check that off if you have it. I don't. I do not have that on my bingo card. Okay. Also, I have a special thing for everyone, a special treat. If I make more than medium wage today, we will do a Rumble exclusive at the end of this program where I will debut my new music video called Verena. Now, I'm not putting it on YouTube because I have consulted with some experts, and we've all agreed that Verena is likely to complain. And if she complains, I don't want her striking my trial stream because that would be annoying for those of you trying to catch up on the trial, whatever. So, in order to avoid Verena whining to YouTube about privacy complaints or any other, and believe me, it would be bullshit because she put all of this stuff out on social media herself. And if you put shit out on social media, I can use it. Anybody can use it. But anyway, YouTube is weird like that. They will allow a privacy complaint. Even if the stuff is out there publicly, they will allow it. So I will not be able to put it on YouTube, but I am going to debut it on Rumble, where she can complain to high heaven and no one will do jack shit about it because Rumble is for free speech and Rumble understands
Rumble's ghetto.
Yes. So if I make more than medium wage today, and I'll let you know when that is, we will by the end of the show, we will get over there and I will debut my new music video. Flux, you've seen it. What do you think?
No, I'm so excited. I'm like, chat, we really want this. Chat, we really want this. We really want this.
You do want it. You do. I have done my AI game is really getting better. It really is. My AI game is stepping it up. So the video is quite good. I may give you like a little sneak peek at the song without the video in a little bit. But yes, it's going to be a lot of fun. It's going to be hella fun, shall we say? Hella fun.
Yeah.
All right. It looks like Skipper Trucking has something to say, and then we will head over to the trial.
Just skipped out on Jay Hips Live to come over here because Jay don't pay, but Megan does.
Well, I appreciate that. Thank you very much. Let's see. Where are we going? We're going to Stephen Messner. This guy is such a douchebaggy looking guy. I can't even with
I will
him.
give you his official John Hughes, like my father owns the ski, mountain level of douchiness that he has.
It's pretty bad. It's pretty bad, Mo. I mean, here we go. I'm sharing it now. Let's go, folks. All right.
Thank you, Your Honor. Can you state your full name?
Oh my God.
James Spader.
So he is gay.
I think so.
Super.
Yeah.
Yes,
I'm allowed to say that.
We're right. We're right. Okay.
I would even say the F word if I'm allowed to say it, but I don't want to get your channel in trouble or you in trouble. But 100% F word, I'm allowed to say it right off the bat.
This man uses more foundation than I do.
He hasn't opened his mouth yet. You're all like gay.
Flux, that's impressive. Flux, that's very impressive. And listen, his partner is a radiologist at Emory. And Emory
is he really gay?
Yeah.
Okay.
Yeah.
Yeah, 100% F-word.
I mean, honestly,
Flux, your gaydar is like 1,000% accurate.
I know.
really
My
impressive.
gaydar is really, really bad because I was like, George Michael? There were no signs.
Me too. I was like, no, he really loves women. Can't you tell?
Flux is like, I caught him like first faith video.
I thought Boy George was just European. I was like, yeah, but all European guys are like that.
but he hasn't talked yet, Flux. Like, how do you do that?
I'm really good at vibes. Even through a computer screen, I'm good at vibes. And this dude 100% is a bundle of sticks or a European cigarette.
One of my best friends, Kevin, his gaydar is spot on too. He can tell by looking at someone's eyes. So it doesn't have to be a speaking photo. It can be just a photograph and he will be able to tell you. He's like, let me see his eyes. I don't know what it is about the eyes, but he says he can tell.
Area. It's something about this area right here.
Yes, that's what he says too. And he's always right.
And I'm always wrong. I need to start looking at the death triangle. You can be like, look, I need to check your nose and eyes.
I know. I didn't know Liberace was
a flaming bundle of sticks.
Oh, no,
I didn't know Liberace was gay either. I thought Liberace was just flamboyant also.
Oh no, my grandma was in love with Liberace. She refused to hear that he was gay. She was just like, no, he's elegant. I was like, that's why he bedazzled
Liberace
everything.
in the stomach.
He's elegant.
Sure, it's Stephen Messner. That's Messner.
And how are you
Oh
currently
my God. See,
employed?
Yeah, there's a lot of
the voice, man, like I don't understand. Why do you have to go with the stereotype? Like, we've worked so hard to move beyond stereotypes. When you just envelop the entire stereotype, it makes people not like you.
He's fabulous.
I'm a child abuse pediatrician at Children's Healthcare of Atlanta.
I think I
How
have a
long
deeper
have you
voice.
held that position?
So I started working
You
at
do.
Children's Healthcare of Atlanta in
So do I.
2007. So July of 2007, so almost 18 years.
I'm going to call your attention to your training and education. If you'll start with your bachelor's and then go from there, can you explain to the ladies and gentlemen of the jury essentially what your formal education is?
Sure. So prior to medical school, I went to the University of Richmond. So that's in Richmond, Virginia, graduated from there. And then I immediately went to medical school, and that was at the Medical College of Virginia, which is also in Richmond, Virginia. And then after medical school, you do something that's called a residency. And I did that in pediatrics, and that's a 3-year training program. And that was done at the University of Florida in Gainesville. So I was down there. So after you graduate from medical school, you're a physician, but then you do your training in, like, I did mine in pediatrics, or you could do it in surgery, radiology, et cetera. And so then when I finished up my training at the University of Florida, I stayed on as a faculty member there. So I've seen children for general pediatrics. I had an adolescent clinic, and I had about 60% of my time was seeing children for concerns of child abuse and neglect. And then in 2007, I took the position up at Children's Healthcare of Atlanta, which is where I'm working currently. And 100% of my practice is seeing children for concerns of child abuse and neglect. So I'm board certified in general pediatrics, as well as board certified in child abuse pediatrics. So the child abuse pediatrics became a boarded subspecialty in 2009, and I got my board certification in 2011. There are 361 of us who are board certified in child abuse pediatrics in the United States, 5 here in Georgia. 4 of them are at Children's Healthcare of Atlanta, and the other one is down in Macon.
Okay, in addition to your specialties and the certifications, I want to talk about the certifications just a little bit more. The certification, is it just an education, or do you have to take an actual exam to pass it and be certified?
Sure. So in order to be board certified, like say in general pediatrics, you have to complete an accredited training program. So a residency that's accredited by the Accreditation Council of Graduate Medical Education. So it has to be recognized. And then you have to, so that's 3 years. And then you take your boards after that, and you have to pass your boards. And then you have to do something that's called a maintenance of certification. So like right now, I've been doing online tests every quarter in order to maintain that, as well as some other pieces. So that's how you maintain your board certification. In child abuse pediatrics, you now you take a fellowship. So you, after your 3 years of your residency, you sit for a fellowship. Those didn't exist back when I became board certified, but we started a fellowship at Children's Healthcare of Atlanta along with Emory University School of Medicine. And I was the first fellowship director, and that's a 3-year training program. So after your pediatrics residency, then you do 3 years of fellowship, and then you can sit for the boards. When I took the boards, I was grandfathered in and able to take the boards based on the number of years that I've been practicing in the field of child abuse pediatrics.
Are you licensed to practice in any states?
Yes, I'm licensed here in the state of Georgia.
Okay. Are you a member of any professional organizations?
The Hellfire Society?
So
by
I'm a
any
member
chance?
of the American Academy of Pediatrics. So that's the main professional society for pediatricians. We also have a council on child abuse and neglect. So there's different councils within the American Academy of Pediatrics. So I'm a member of that. And I sat on the executive committee for the Council of Child Abuse and Neglect in the past. I finished my 6-year term.
Do these councils actually do anything?
So that
yeah, what do they do? What do you do here?
Listen, all he does is go around and train other creeps to do what he's doing. That's he got grandfathered into this because of his experience. Like this made up experience of finding child abuse, and he goes around teaching others to do the same thing. That's crazy. It's crazy.
Yeah, it is. He does have nice hair, though. I'm going to give it to him. This man has a beautiful.
He's a gay
head
man.
Of
Of course, he has nice hair.
He has a beautiful head of hair. Like this is giving Dr. Goodhair a run for his money. Now, Dr. Goodhair still has the best hair between these two. Dr. Goodhair's hair is even bigger than this.
Single decent thing about this human, like I can't.
Also,
he's disgusting.
You gotta give him the hair, Jennifer. He has a beautiful head of hair.
I refuse to look. I refuse to look.
Well, look, you can now check off hair talk from the bingo card. At least
I will
there's
say
that.
that one little piece looks like he hairsprayed it in place to make it look like I'm not too prissy.
Right.
Like, I could be rough, but
you mean this part right here? Right
yeah,
here?
the little like bell from Beauty and the Beast,
it's like right there.
Yeah.
Yeah.
He augmented the shit out of that.
Every other piece is exactly in the right place except for this right here. So it was like, you're right. It's like, this is so it doesn't look too perfect.
You should have put so on the bingo card, because this man is going to be like, yeah, so.
Oh no.
Oh no, he's a so guy.
So. Or he'll say,
he's a
yeah, sure.
self-righteous
yeah, sure.
hat.
Is he even in the same league as Dr. Goodhair? Not even close. That's true. Dr. Goodhair, I've never seen a head of hair on a man as good as that ever in my whole life. He's got something real special. Good Lord. I know I'm going to hate this guy though. I don't hate him yet though. I'm slightly annoyed. I'm slightly annoyed.
Is responsible for putting out policies, reviewing technical papers as it pertains to child abuse and neglect. I'm also a member of the Helfer Society. So that's a society that
there it is
just for child abuse pediatricians. So you have to have someone nominate you to become a member of the Helfer Society.
Do you also have to mutilate a chicken?
You also have to sacrifice a small child.
Yes.
Do you have to learn the secret handshake? The secret
which may or may not include the blood of a small child. Do you have to also drink adrenochrome to get into this thing? Look, you go there and you walk in the doors. This is the first thing you hear.
Okay, Megan, to be fair,
And
their
there's guys in
symposia
Druid
are
robes.
rocking. Like, you go into the conference room after that, there's feathers, there's candles. I mean, they must have really fun times.
It looks like a scene from a Stanley Kubrick movie. It's like what is that? Eyes Wide Shut. It's like an Eyes Wide Shut party.
Yeah.
The American Professional Society on the Abuse of Children, so that's called APSAC, and that's not just medical providers, but also like social workers, other professionals who work in the field of child abuse and neglect.
Do you subscribe to any professional journals?
Sure. So as a member of those societies, I have access to their journal. So I get the Journal of
Chad, I'm gonna give it
Pediatrics
to you.
through AAP.
I'm going to give you witch sighting. I think we can check off witch sighting. Yep, it was the Hellfire Society that did it for me.
Through Helfer Society, we have a publication that's called the Quarterly, and in the Quarterly,
I
it comes
need
out
to
quarterly,
subscribe to
and
that.
we review different articles.
We're gonna
they're
have to
critically
put a
reviewed,
bingo card
from different
or
journals.
a bingo slot where
So
Flux wants to
I'm able
choose
to
Violet.
access any of those journals
Violence.
through Children's Healthcare of Atlanta.
Okay, Flux chooses violence. That's going on tomorrow's.
Well,
Or through Emory.
Isn't the training for this particular subspecies of doctorologist only 3 years in like some online classes? Like, there's not actually medicalology that's
They're
going
trying
on.
to
They're
make
just
it
like,
sound. They're trying to make it sound so so elite, and it's really not. It's one of the lowest things you can do as a specialty. It has one of the lowest requirements. It's a joke. Most real doctors are like, that's a joke. Like, what your specialty is a joke. It's not a specialty like neurosurgery or anything like that.
Oh my
It is a joke.
I want a one-on-one between the neurosurgeon who thought his ish didn't smell in the Karen Reed case and this guy. So what would you say you do as a specialty? Oh, I just tell people with strokes and stuff. Now you take kids away from their parents after you read an article, a blog post. What is this going?
I'm going to let the chat also have Flux is going to get angry. I think she has definitely showed us that she's
angry from the moment I saw his face.
It is true. It is not a rumor. The L's do not like the G's. We're a part of a civil war here.
Man, like I said, I love drama just as much as the next person, but fuck, man, Gaiman take it way over the top. Like, tone it down.
To be fair, I like someone who has meaner thoughts than I am, so I can feel like a relatively good person. So bring all the gay men to me, because I'm like, oh, like, oh my god, sick burn. That's pretty good.
So I can see if there's an article that I wanted to look up, I can pull that up through our electronic library system. And so those are generally published in Child Abuse and Neglect, the Journal of Child Abuse and Neglect. Through APSAC, there's a publication called Child Maltreatment, so I also get that. But there's a wide array of publications that not necessarily that I subscribe to, like pediatric radiology, for instance. If there's an article in there that is pertinent, I'm able to pull that up and review that article because we have access to it.
How many patients approximately have you treated in the course of your career?
Oh, it's thousands.
Have you testified as an expert before?
I have.
Approximately how many times?
It's over 200 times.
And have you testified exclusively for the state, the defense, or a mix?
No, it's a mix.
In what states have you testified as an expert?
Yeah, so I've been qualified as an expert in pediatrics and child abuse pediatrics and testified in the states of Georgia, Florida, and Illinois, as well as in some military courts.
Your Honor, at this point in time, the state would tender Dr. Stephen Messner as an expert in child abuse pediatrics with a specialized training in the field of child abuse.
Mr. Hood? Well, we've gone through this before, and I have no objection to continuing this as but I'll say objection is Dr. Brown. In terms of the nomenclature that is applied to him as a child abuse pediatrician, that
He looks gayer with the glasses.
Right? I'm
Your
like,
Honor, the
oh my
language I
god.
just used is the language
Even
you
my
approved
gaydar
for
is
Dr.
picking
Brown.
that
I
up.
wrote it down verbatim.
I didn't approve Dr. Brown to be qualified as a child abuse pediatrician. I qualified her as an expert in the field of pediatrics with a specialty in child abuse. That because we did go down that path, Miss Fox. I did not.
Thug judge. Thug judge. Did you? Don't you misquote me. Don't you misquote me. I did not say that. Oh, God, I love this judge.
I understand. You're moving for a mistrial when you got additional time and you can call the same witnesses to address whatever issues. Is that what you're saying?
Yes, Your Honor, because we
don't.
Okay.
Can we go to exhibits, please?
Denied. I love this judge.
Did you hear Fox, though? She was like, I wrote it down verbatim.
And the judge was like, no, you
As
didn't.
If we're all going to just forget or not know what freaking happened. Is she stupid? That's crazy.
Oh, thug judge. I love her. I love Auntie Sue. God, she's the best.
Yeah, she's like, no,
I'm waiting for her to slowly unwrap a Werther's even longer than she normally does and just drop the wrapper like a mic.
Your Honor, child abuse pediatrics.
Miss Fox, then I'm gonna clearly
rip
because
you a
we
new
went
one.
down that path. I'm going to agree with Mr. Hood. I qualified her as an expert in the field of pediatrics, and I'll correct the record if it says otherwise. I intended totally for her to be qualified as an expert in the field of pediatrics with a specialty in child abuse, because I agree, I don't like the nomenclature child abuse pediatrician. I don't like that nomenclature, and I agree with the objection
We don't like it either.
made by Mr. Hood. I agreed with it when he made it the first time. So, Ms. Bernard, do you have anything to add? Any objection to this request by Ms. Fox?
And yes, Your Honor, I would have joined.
Is the jury there? They are still there. Yeah. Oh, this is so good that the jury is there. The judge is like, fuck you and fuck you too. I said what I said.
Yeah, and this is a made-up specialty, and I don't like it.
And I don't like it. What's going on with Auntie Sue's hair today, though? It's looking a little messy. Looking a little.
She's stressed. She's really.
It's coming out in her hair.
Dealing with this baby doll hair lady.
Yeah, she's dealing with brassy locks, and she's just done. I mean, she's glad she wasn't wearing a couch cover today, but the plaid and overlong shirt or sweater set is not appealing.
Oh, this woman. She's definitely a cat lady. I mean, I'm sorry to all of you cat ladies out there, but this one is a cat. She just is. I can see it. I can feel it on her. Sorry, Flux. I know you have lots of cats, but I wouldn't call you a cat lady. No, you only have two, really.
Well, technically, I have 4.
Do you really?
3 indoors and an outdoor. But, hey, man, if it keeps people away from me, I'll be a crazy cat lady. Like, don't talk to me.
Right, you are 2 cats away from being a crazy cat lady. I hate to break it to you. I give you 2 more cats before we start putting you in that category.
Okay, don't worry, no more for now.
And Dean, all catmen stay low.
Being qualified as an expert in pediatrics. However, whether or not child abuse occurred in this case is the ultimate legal conclusion for the jury to determine. So we believe it would be inappropriate for him to be qualified thusly, and we would ask that the court make its same ruling as it did with regard to Dr. Brown.
And if I recall, that was the same objection Ms. Bernard made as to Dr. Brown. And again, I concur with that objection. He is definitely qualified as an expert in the field of pediatrics with a specialty in child abuse, but I am not going to qualify him as an expert child abuse pediatrician. I don't like that nomenclature. So, so I would grant your request that he be qualified as an expert in the field of pediatrics
With specialized
with that specialty.
training in the field of child abuse.
That's
and I would
correct.
so tender.
Then he'll be admitted for that purpose.
What did you do to prepare for
Ooh,
the
she's
evaluation of Jameson Timms?
Sure. So
Oh, he's the.
I was in clinic.
What
on the
was
day
that
Jameson
look?
came.
What was
So,
that look?
um,
Can we go back? Because that was really weird.
And he'll be admitted for
his
that
face.
purpose.
Is it inappropriate to
What
say
did you do to prepare
you are
for the
what you eat?
evaluation of Jameson Timms?
Sure. So I was in clinic on the day when Jameson came. We have a clinic. It's called the Stephanie V. Blank Center for Safe and Healthy Children. It's one of the child advocacy centers here in the state of Georgia.
Don't go there.
And so when I learned that he was coming to clinic, I did what I do with all patients is I review what's in the chart, if they've been seen previously at Children's Healthcare of Atlanta, or I review outside records if they've come in. I have access to what we call an intake report, which is put together by our intake coordinator. Sometimes that'll include, like if we're seeing a patient for child sexual abuse, it'll have.
Your Honor, I would object at this point. We're not interested in the general, what he does in other cases. The question was what he did to prepare for Jameson's case.
Ms. Fox.
That's fine. That's the question I asked.
I'll sustain that objection.
Where is he lost?
Okay, so in this case, I specifically looked at the intake report, which explained why Jameson was scheduled in the clinic that day. I reviewed the notes that were in the electronic medical record system, which were from Children's Healthcare of Atlanta, so I have access to that. I can pull up all of the labs, all of the imaging studies, so I reviewed all of that prior to sitting down with
Megan,
Jameson's
pause there.
family members who had come and accompanied him to the clinic on that.
This is nothing out of the realm of the ordinary that every doctor is going to look at. They can look up your medical history. He is preparing no differently than a normal pediatrician. Again, he makes it sound like he's going above and beyond. I looked at the medical charts. I looked at the records. That's what you're supposed to do for every patient before you go talk to them.
Yeah. Yeah, like why is he making it sound like
All
this is
he
some
really
big
did
deal?
is read Verena Brown's report, and he's like, Verena Brown said, so yes. That's all he really did. We know that.
Right. Right.
Day, which was February 3rd, 2022.
Not what they said, but which family members came on that particular day.
Sure. I'll make sure I get this accurate. So it was his paternal aunt, Brittany, and the paternal grandmother, Renee Timms.
Okay. In this particular situation, was a separate skeletal scan done for the February 3rd visit?
Yes, it was. And that is x-rays of all the bones in the body, similar to what he had done during his hospitalization. And he also had two similar studies that were done up at Erlanger.
Okay. I want to go over what was the reason for having a separate skeletal survey done when he had just been in the hospital in January?
Sure. So that is standard of care. If we get a skeletal survey, so that's x-rays of all the bones in the body, we're going to get a follow-up skeletal survey in approximately 2 to 3 weeks. And the reason we do that is because on occasion, and I've seen this personally on a number of cases, there can be very subtle fractures that can be missed on the first set of x-rays. So what we do is we let time elapse. We let the body do what it does when there's a broken bone, and we let it start to heal. And so you'll generally see healing on a broken bone at about 7 to 10 days. Sometimes, the upper limit's maybe 14 days. That's why we wait those 2 to 3 weeks. We repeat the x-rays. And if we see that there's any evidence of healing on any of the bones, then we can go back and look at the initial x-rays and see, was there something there that maybe was overlooked? Because sometimes these x-rays can be difficult to pick up those subtle fractures. So that's why we did that follow-up skeletal survey.
Wait a minute.
To ensure that we had thorough.
Think
okay,
about
so
that.
the only testing that we do is one that's really hard to find microfractures.
We radiate
Am
the
I in
child
the
again.
Matrix?
We radiate the child again in hopes that we can find something there.
Yeah, it sounds to me like they're looking for a needle in the haystack and they're determined to find it whether or not it's there.
Yes, he admits it. He's like, it's really hard to find some of these fractures. So we take it again in 2 weeks in case we miss something. It's disgusting to radiate these kids like this.
And B says, we need annoying hand gestures on the bingo card.
Why is his elbow attached to his side? Because he's just doing this weird little thing. Although I am glad he didn't try to appropriate the knife hand, because I think I would have just bawled out laugh. Like, because he can't do the knife hand.
He's so scripted. Like, he's done this so many times. You can just
Oh,
tell
yeah.
he's very, very scripted.
And Mel Klump wants to see that video today. Thanks for the 2. All you ladies are looking beautiful today. Well, thank you. We appreciate that. And Rizilla's Realm member for 13 months. Any chance of an ostrich for this? I have ostrich updates, but they are really, really, really upsetting.
Yeah.
I don't even know what to say about it other than that fucking government of Canada is really on my last nerve and they should stop doing what they're doing. But so far they've injured an ostrich. They have injured an ostrich. They're terrorizing the ostriches at the farm by pulling in huge trucks and running drones over them. And so the ostriches got spooked and one of them ran headfirst into a fence and fell down and hasn't gotten up since. And that they tried to mislead the public into believing that that ostrich was sick with something. But no, the ostrich is not sick with anything. The ostrich has been hurt because of the way that the Canadian government is treating them. The police have no idea how to deal with ostriches, and they are scaring them. They're scaring them into stampeding. There was a stampede that happened yesterday. I think I saw a video of that, which is where they could get hurt. They've built these fences around them that they're not used to having. Yes, the ostrich fell down. And unfortunately, there's concerns about whether or not they're giving the ostrich who fell down proper hydration and whether they're treating that ostrich. Yeah, it's Invade Canada is right.
What happened to making Canada the 51st state? Let's do that again.
I feel like they really want that. They really want that because
There
that's how
actually
you get
is
that.
a Wexit for, I believe, Alberta, Nova Scotia, and British Columbia. Alberta for sure, but there is a Wexit that is going on. And I say, welcome. I'm glad you aren't Puerto Rico.
You may check off Invade Canada off of your cards, and also Bird Talk. Bird Talk can be checked off your bingo cards, as well as Invade Canada. I mean, honestly,
Make
this
sure
is
to
the
change
kind
your
of guy, by
profile
the way.
pictures.
Yes, this is the kind of guy, by the way. This is the kind of guy who would order 300 or 400 ostriches murdered for
Yes, he
no
would.
good reason. Like, this is that kind of guy right here. I mean, if you don't think that these stories relate, I got news for you. They do. It's all
Well,
these same
yeah.
type of bureaucratic assholes who do this kind of thing.
Thoroughly looked at all of the bones.
Okay. On the follow-up survey, what was the result in relation to the ribs?
Yeah, so on the follow-up skeletal survey, which was done the same day that I saw Jameson in clinic, so February 3rd, 2022, the 3 left posterior rib fractures that were seen on the prior study had completely healed. So the bones showed that they were healthy and had gone through all the remodeling, and you couldn't even pick up that they were there. The vertebral compression fracture in T10, which is down at the lower thoracic spine, you could see that that was continuing to heal. So you saw continued healing of the compression fracture in the spine, and you couldn't see any more evidence that there was a fracture in those 3 ribs that were previously seen on the first skeletal survey.
I want to talk about the ribs first. Can you describe to the ladies and gentlemen of the jury how pliable a baby's ribs are?
Yeah. So even like our ribs, like if you push on your rib cage, you'll feel that there's some give to your ribs. Infants' bones.
All right, hold
have-
on. Jennifer has helpfully sent me his Google ratings. Here we are, Stephen Messner. Stephen Messner, MD. He has a 1.4 out of 5 stars. Look at these ratings. Here's a 1 star. Stephen Anthony Messner is one of Satan's minions. Witchcraft confirmed.
Oh my God.
That preys on scared and confused innocent parents and causes lifelong term damage on families. Stay away from this incompetent doctor turned businessman. He is such a low-grade doctor that he either cannot tell the difference between an actual innocent injury or he chooses to ignore facts, science, and medical experience to recognize a medical condition. He profits heavily from working with CHOA through the Stephanie Blank Center for Abused Children. Every case he reports as abuse at CHOA gets turned into a money-making machine by sending it back and forth between the hospital and the center for further evaluation and testing. He could care less about a child's well-being, not interested in doing any kind of medical investigation to find out the real medical cause of an injury. Furthermore, he is in charge of training other pediatricians on how to recognize signs of child abuse, therefore funneling more and more cases of false allegations of abuse straight to him. He works directly with state agencies as a medical expert and charges heavily, orders unnecessary tests through CHOA just to bill the insurance, orders unnecessary x-rays for your infants and ignores the risk of exposing them to radiation. He has a very good reputation with the law enforcement, which makes it difficult in trying to fight against him. He is also used as an expert witness for the state when he's successful in pushing a defects case to court level by having law enforcement place charges. Once again, he charges a pretty penny for his expertise on the stand. He is incompetent as his job as a pediatric doctor, does not have the expertise to diagnose and identify simple, common conditions. And his focus from the moment he gets involved is to use whatever medical condition landed your family in his care to prove abuse. He is not there to help innocent parents find a medical answer. He is pure trash. I love this person, whoever wrote this.
I love this person. We need to get them on the stream.
He is pure trash.
Okay.
Only cares about money and reputation. If the staff at Stephanie Blank Center is full of insecure bullies that will lie to defects and everyone involved in the investigation to make it seem as if a parent is not willing to collaborate. Stay away from Satan. He is pure evil.
That's it right there in a nutshell.
Avoid this man.
Stay away from Satan.
He is power-seeking, non-caring, and does not care about the welfare of your baby. Here's another one. Extremely judgmental. Did not tell me anything. He sucks. Dr. Messner is a terrible doctor and doesn't run the proper protocol when it comes to child advocacy laws. He will just assume it's abuse and not listen to the voice of reason. He doesn't know what he's doing at all. I would never take my child back to see him. Stay away from this doctor. He has let his money go to his head. Now he's got a 4-star review here. This is probably done by his boyfriend. Caring individual, especially with my son. Highly recommend this doctor.
Why not give him a 5? Then?
Yeah.
We recommend him. What's going on?
Also true.
Yes.
All right. I lost my page. Doesn't get all the fascists? No, the facts. is looking to prove abuse. Runs traditional tests to prove or does prove, but doesn't really know the situation. So he does not have good results.
No, and again, where is the advocacy for patients? You know how doctors always come out, or hospitals, once, J Hatch was found to just be leaving oxygen tanks. Your safety is our highest priority, except when we were not washing our hands between operations. So if you're a hospital that can't function to wash its hands or hire someone who knows doctorology, maybe could you not be affiliated with a state?
Yeah, that would be nice.
Mm-hmm.
The photo lady, the link to the Timms Fund is in the description of this video. If you're looking for it, that's where it is. And mods can also drop it in the chat.
A higher percentage of cartilage than bone than our bones do. So as we mature, the skeleton matures, you get more bone as opposed to cartilage. So cartilage is like your ear, that's like flexible.
How can you say
infant
ear
bones
gaily?
are
But he did.
bendier, if you will, than adult bones, and the same with their ribs. So there's some pliability there. So it takes, a non-trivial force to actually break those bones.
How much force would it take to break a baby's rib as far as why is it pliable as a baby, and then what would it take to actually break the rib?
Yeah, so you need to have
Miss Peanut.
compressive force about.
Yes, we may now check off Bendy Baby on the bingo card, as you heard him talk about the pliability of a baby. I think that rates for Bendy Baby. Go ahead.
So is his theory squunched too? I mean,
Didn't
also-
he just say earlier? He said bendier. He said.
Oh, did
Yes.
He said bendier.
All right. Well, Bendy Baby. He hasn't said the squunched word yet, but we'll see if he gets anywhere close to that description.
Also, there are actual fields of study that can give you how much force would be required to, break a bone. Now, they might not have extensive studies as far as infants but the car safety industry has actual information on this. So you can get the relative amounts of newtons or,
This
things
has
like
been
that.
brought up in these trials before. The defense team does a pretty good job at arguing there's been no real study. You can't take a newborn baby and break their ribs. Like, you can't do anything to find out what force will break them. So it's really when they start getting into this to talk about force, he's not qualified for that. He's not qualified to talk about it.
Chest. Now, in Jameson's case, the ribs were fractured posterior, and so posterior just means on the back. So anterior is the front, posterior is the back, lateral is the sides.
He knows a lot about the
when you
back.
saw
boobs.
the ribs that were fractured, it's posterior, so on the back to the side of where the spine is, so where the ribs going to join to the vertebral body.
On the back.
And that's in a location where if you pick an infant up, typically when people pick infants up, they're facing one another. So where your fingertips are, it's at the back of the baby. And if you apply a compressive force, you squeeze, the ribs are going to bend until they
it's very
fail.
close.
And when they fail, that's when you get the fracture. So this isn't like a trivial force, like just picking a baby up, holding him about. This would be a forceful squeeze to the chest to pull those ribs forward. And that's how you.
He used blue paint in his testing.
Oh my God. Could you imagine? This would be the a-hole that would dress up in an adult baby onesie and have his lover try to squish him and then say, we use this blue paint.
Do you see the blue paint on the...
And he'd be like, I have a dummy because I want to be, I'm a method actor.
Disqualified.
Get the fractures of the ribs.
Would the caretakers of the baby be able to see a difference in the child after the ribs are broken?
Sure. So infants are wired just like we are to experience pain. Bones have nerves in them.
They're
they
not
have
a
blood
different
vessels in them.
species.
So when a bone breaks, it hurts. So
No
I would
shit.
expect that.
I'm glad you're
Oh my
doctorology
God, we're learning
expertise.
so much.
This is like that
We're learning-
sentient anatomy shit. Like,
Yeah.
the body can feel and sense things.
We're learning
Babies,
that the body can
babies
feel.
feel pain. The fuck, man? Stop talking to us like we're 5.
The bones were fractured or broken. That
I'm
they
feeling
would recognize that.
distinctly
You recognize that
Kamala
this was
Harris
painful
right
to the
now.
baby.
Without an explanation by the parents of an accidental injury, is this finding consistent or inconsistent with child abuse?
Sure. So posterior rib fractures are highly specific for being a result of non-accidental trauma or child abuse,
Ow, and
physical
why
abuse,
though?
in an infant less than 1 year of age. There's a couple of other fractures
Did
that we
the
also place in
Hellfire
that high
Club figure this
specificity
out?
category.
I'm sure the Hellfire Club did its own studies on how to break babies' bones. It feels to me like that's what they're doing in their super secret, top secret meetings.
Yeah.
Without having any this is trauma. It's trauma to the baby's body. So if there's not an accidental trauma, I was not provided with any type of accidental trauma that occurred to.
And if they had said it was accidental, would you have let them go, doctor? If they had said, oh yeah, Jameson rolled off the couch on accident, we weren't watching, and yep, that's probably how that happened. Would they have taken him away then also? Yes.
Yes, the Talon family that is in the same district as Carrie and Brady have a reason. They came in with an explanation for their baby's injuries. You can read about that on youarethepower.net, and doctors didn't want to hear it. So it doesn't matter if you have a reason or not.
It doesn't. And in Emma Hernandez's case, there was a theory that perhaps the other baby jumping on the bed might have jumped on the baby and caused an injury. That was a reasonable theory, but it didn't matter.
Emma's leg, when they got out to go camping, all as a family, when they got to the campsite, Emma's leg was kind of like positioned weirdly. And the aunt and uncle were worried about that. She didn't cry. She seemed fine, but it was positioned weirdly. And they remembered that. So when Emma's leg was swollen, they brought that up like, hey, last week, this happened with Emma's leg in the car seat. Do you think that? And they're like, no, has nothing to do with it.
So it doesn't matter if you have an alternate explanation. If they want it to be abuse, it's going to be abuse no matter what you say.
Yes.
These people are so full of shit.
The baby, I didn't see that documented anywhere in the medical records either. And this is something that Jameson would not be able to cause to himself. You can't pull your ribs forward. So without having some other kind of trauma, no one's provided any other kind of trauma, then yes, I'd say these are consistent with inflicted injuries. They're consistent with child physical abuse.
Okay. In this particular situation, based on your training and experience, what type of accidental injuries would cause that type of injury on a baby?
So it'd be really rare. We see that rib fractures they're a very rare injury that you get even from accidents, even like in children, older children who are jumping around, falling off of playground equipment. If we see rib fractures in children, up to 3 years of age, and we don't have a good explanation for it. We don't have like a known history of trauma. It has a 95% predictive value that it was inflicted. So that's really telling that these kind of injuries, we need to kind of correlate it with what happened. If we don't have a history, then we need to understand that these are fractures that occur from the ribs being pulled forward. Now, in an accidental mechanism, it would have to be something that significantly, caused a significant force to the backside of the infant's body and pushed the rib forward, bent it enough so that it then failed and broke.
Is he going to explain why there were no corresponding bruises?
Face down on a surface and something really heavy fell on the baby, or somebody stepped on the baby, something like that, could cause that force to push the rib towards the center of the body.
Do they hear
So now they're stomping on the baby like Ethel and Lucy in the wine country?
Like, does he even hear how ridiculous he sounds? Like, does he hear himself?
Mm-hmm. Listen, one of these child abuse pediatricians told a parent that the only way that the injuries to the baby could have occurred is that someone drop kicked the baby.
That was the
drop
Sullivan
kicked
family.
like a football.
Barbara Knox.
Yeah.
Barbara Knox said that. Yeah. And this 95% thing that he just said. So Emmanuel Pena is the child abuse pediatrician at CHOA. And in the Hernandez juvenile adjudication hearing, Emmanuel Pena came to testify against them. He brought 0 x-rays. He brought 0 records with him. He sat on the stand and he said 95% of these fractures are related to abuse. When Doris Good, the defense attorney, asked, where are you getting that information from? He told her she could look it up on the internet.
Oh my God.
So
I remember that.
This is just like the thing they say, like, hey guys, stick with this number, okay? Make sure we all say it.
Oh my God.
Those would be the ones that I would think of.
Do you always see internal injuries with broken ribs in babies?
Oh, no. On occasion we will, like if the ribs caused the lining of the lung to be injured, then you can get what's called a pneumothorax or a hemothorax. So you get air that's collecting there, blood that's collecting there. But typically, we're not seeing any kind of internal injuries from the rib fractures. It all depends on the amount of force that's there. So how significant that trauma was. If it was enough force, enough trauma to break the rib and then also cause injury to the internal organs, then of course you're going to see injury there. Like say if you were run over by a car or something like that. But it's not uncommon to just see rib fractures without any kind of injury to the internal organs.
If Jameson had been bruised during the incident as a child abuse pediatrician, or as a pediatrician, would you expect the bruises to be gone, understanding that the calluses that were there on January 14th had actually resolved by the 3rd? So you're at that stage of healing.
So it's actually not uncommon it's the rule rather than the exception to have no bruising. So it's very rare to see bruising. And so we only see nearby bruising in about 9% of cases where there's rib fractures. And that's because the force is generally not like a sudden impact, which would cause the blood vessels to burst. And that's how you get blood outside of the blood vessels. That's what a bruise is. It's usually if it's a compressive force that occurs over time, then the blood vessels can kind of mush away from where that force is. And
Pause,
then
Megan.
the blood vessels aren't breaking, but you have that force on the bones causing them to break.
Okay,
You're making shit up.
Maybe I'm anemic, but maybe because you only see corresponding bruises with 9% of cases, those are the actual abuse ones. Did you ever stop to think about that, you idiot?
So these parents are not punching their babies. They're just holding them and they're squeezing them for a certain amount of time. He has not let us know how long that is, but if you just squeeze your baby, you can pop their ribs and not give them bruises.
The blood vessels will just smush around.
Right.
I get bruises from blood pressure things because my blood pressure is generally low, so they can't ever find my heartbeat, so they end up going like to strangulation levels. I have bruises from those, so don't tell me the compression doesn't cause bruising. In fact, you drop something heavy on your foot, it's also the compression, and breaking of those blood vessels against, the bones because the force has been applied. It's compression too. It's not just the heaviness of the...
If this baby did have bruises there, he would have come up with a theory on why there were bruises there. Like, all he's doing is spinning it to fit that narrative. And if anyone can't hear that, you're just dumb. It's ridiculous.
No, Mo, you don't get the bruise from dropping the thing on your foot. You get the bruise from the blood vessels not being able to smoosh out of the way.
Right.
And
that does. I mean, I'm not a doctorologist, and he is a 1-star doctorologist. But I'm a 5-star podcaster, so I don't know how that squares.
It's just ridiculous. To hear that in person is like, what is he saying? And does anyone believe that?
No
one believes this.
They're making shit up. He's making shit up.
You check off making shit up on the bingo card. I don't have that one. Damn it.
Dang it.
I like how hard this is getting. Making shit up. All right, so if you're keeping track or not keeping track, here's what we've already checked off on the bingo card. Megan hits the wrong button. Witch sighting, bird talk, free space. Megan snorts, hair talk. Flux is going to get angry. Thug judge, invade Canada, bird talk. I already said that. Bendy baby, and making shit up. There we go. All right.
And then bruises, if there was a bruise, it's going to evolve over time and go away, right? So we're seeing a healing fracture.
You learned all that from Johns Hopkins, you said.
Evolve is a strange way to say heal.
7 to 10, 14 days or older. It was likely older because by the time I saw him, which was 2 weeks later, they were completely remodeled. So I wouldn't...
Flux, were you
remodeled?
Wouldn't surprise me to.
Yeah, my cat was just chilling with me for a second.
Not.
All right, Flux pet's cat.
Enough time had elapsed that I would expect if there was any bruises that they would be gone.
Damn it,
and
I
to
don't
not
have
see
that one
them
either.
on Dr. Brown's initial exam I don't find that unusual at all because they were already in the healing stages.
Would the broken ribs be consistent or inconsistent with a birth-related injury?
No, they wouldn't be for a number of reasons. It's when we typically see bones that get broken during the birthing process, it's usually the collarbone, and it's from larger babies when kind of birthing the baby and having difficulty getting the shoulders through the birth canal. You can get pressure placed across the shoulders, causing the clavicle to break. Sometimes we'll see long bone fractures, so like the arm or the leg.
Yes,
just from
Chad. Overruled should be checked off also. I forgot about that. We had an overruled.
Manipulating the baby. Rarely we will see
rib
fractures.
We were too
It's usually
involved
from
in
larger
judge
babies
to notice.
and with a difficult delivery. Jameson had 2 sets of x-rays that were done at Erlanger, and there were
The Squanchinator wants to know, do I need to change my name to the Smushinator now?
Yes. And no, I say you keep one and do alternate days.
no fractures seen on there. We didn't see those rib fractures. So if he had sustained any kind of fracture anywhere on his body from the birth process, we would have picked those up on the Erlanger x-rays because those x-rays were done.
Oh my God, that is the
for you,
gayest
when he was
eyeglass
1
put on
month
I've
old
ever
and 2 months
seen.
old. So there's ample time that you would see those callus to form on any broken bone. So we can rule that out as any kind of
This guy's whole
positive
existence is
factor
his
for,
job and his
the fractures
sexuality
that we
and
saw
nothing
on,
else. That's
Jameson.
his life. That's
I
it.
want to switch to the
I
compression
do wonder
injury.
if he's the pup or
on
the
T-
master.
I see him at the Pride Parade as a leather daddy, and I can see it.
I can see him
I
being the
hate that I
puppy.
can see it.
I don't see him being the coach or whatever one calls the non-puppy party. That's
Non-puppy
it.
party.
Mo's going to be going to all the Pride festivals. Like, look, I just have a question. Like, what am I supposed to call you? Like, the pup owner, the leather daddy fur baby owner? Like, I don't know what to do this.
Oh, look, I am willing to pay money if anybody has photos of this guy at a Pride Parade. I need to see it.
Oh my God, he's like Anthony Weiner and he has the suspenders, no shirt, and the leather.
Whatever it is, it's humiliating. I got to tell you, it's whatever it is. It's an exercise in humiliating someone.
He's definitely into humiliation. 100%.
Yeah, but as the humiliator or the humiliatee? See,
That
I'm
is the
thinking the
question.
humiliatee.
Yeah. I think so.
Wait. All right. While we're doing, I have an idea. I'm going to give you guys a little taste of what I think might be happening at the Pride Parade.
can and ask you, outside of child abuse, what is a typical mechanism for causing a fracture in that location of the body?
Yeah, so it's a compression fracture. So
wait.
with the vertebral body, it's almost like a
I'm
can,
honestly
right? So
surprised he
they're all
doesn't
stacked
have a
on top of
little
one another.
rainbow
That's our spine.
lapel pin.
What we're seeing is that the whole vertebral body was kind of squished down. So it's almost like
Squished.
stepping on that can. So you have what we call an axial
Or do you
load,
mean
which means that it's
squunched?
going down,
Okay.
kind of pushing your head towards your butt, like you're
Okay,
squishing
so they
down
not only
your spine.
stomped on the
That's
baby, but they
compression.
did it
So anything
hot
that would
dog
apply
and
that kind
hamburger
of force,
style?
to the body can
Apparently.
result in a vertebral compression fracture.
Is there anything
So,
about
and
the
there's no
injury
way that
itself
could have
would allow
happened in a
you to
birth?
date it specifically in relation to the ribs? Were they at the same
Where a
time
lot of
different, or you can't
squunching
tell
does
from the
go
X-rays
on?
alone?
No, so
Like, I think the most
you know, the
squunching goes
radiologist
on.
may feel more comfortable, giving that kind of time frame. It's difficult to date these things. It would be great if we could
Why
say,
are
well,
you
this
smiling when talking about
3
children
weeks,
getting
2 days old.
injured?
I mean, then we would know.
You
exactly
know,
what
I
happened.
don't know
But
when they
unfortunately,
squunch the
that's,
baby.
beyond the limits of X-rays. So we can see if there's no evidence of healing, we know that it's early on, what we call acute. And that would be no evidence of any kind of callus. You can see the fracture line. Then when it starts to heal, we'll see that soft callus that'll evolve into a harder callus, and then eventually it'll go away. And that takes time. We start to see that, like I mentioned before, about 7 to 10, maybe up to 14 days, but generally in that 7 to 10 day range. So then we could say that's a healing fracture. And then once it's completely remodeled, that would be, months later. I wouldn't want to overstate, what we're seeing with the compression fracture. Say it's already healing on that first set of X-rays, so it's not fresh.
I don't know if this is
Just like the rib
horrific or
fracture's not fresh.
magnificent.
Could they have occurred on the same date? Sure. Could
It's
they have occurred,
cringe-hilarious. You feel
they-
cringed about it,
There
but
we
it's also
go.
hilarious.
That
There's
is
really
so
no
much
way to
better. Now I can.
accurately say that.
I like that he's vaguely French and a leather daddy. Because he's got a beret.
It's like, the rib fractures, when you break a bone, it hurts. So, even like when you bruise a bone.
This makes so much more
We've all
sense now.
experienced that. These things are painful. It's the trauma to the body, and babies are capable of experiencing pain. So I would
Duh.
expect that the baby would show signs of pain when that vertebral body became injured.
Without an explanation by the parents of an accidental injury, is this finding consistent or inconsistent with child abuse?
Yeah, so it's consistent with an additional injury that's also consistent with child abuse. Given the workup that was done, the history that was provided, which there was no trauma history to explain that.
Why also does
looked
he
at
eternally look
the integrity of the
surprised?
bones. We looked at the bone health. We looked at the genetic makeup.
Lower your eyebrows,
There
sir.
was nothing else that
You're
would
His
getting
Botox is fresh,
explain,
so he can't move his
why
forehead
these
very well.
bones, the ribs, the vertebral body, why they were fractured. It's trauma, and there's no history of some sort of trauma that would account for a compressive force about the chest.
I'm going to get
cause rib
letters
fractures,
for this.
and then
There's going to be
axial loading force,
emails.
to the spine. To
Someone
cause the
from
vertebral
CHOA is
fracture.
going to contact me via a
Hypothetically, are the injuries
Well, maybe
of
they
the
shouldn't
rib
steal babies and
the
we wouldn't do this to
T10
them.
fracture
Yeah.
consistent with someone grabbing the child, squeezing, and then
It's very
slamming
easy
down
to
on the
not
butt?
steal babies.
Oh, sure.
Wait a minute. Excuse me. Listen to this question. Listen to this question.
To cause a vertebral fracture.
Hypothetically, are the injuries of the ribs and the T10 fracture consistent with someone grabbing the child, squeezing, and then slamming down on the butt?
Oh, sure. That'd be that would account for
That's what their
So
theory is.
they
Grabbing
treated
the child, squeezing really hard, and then slamming it down.
Like a
Yeah,
butter
so-
churn?
Prosecutor Fox figured it out when Detective Faulkner couldn't figure it out.
But Faulkner had no idea how this happened.
No, don't know, don't care, says Faulkner.
Photo lady, thanks for the 5. This is for your magnificent artistry. Well, thank you very much. I really enjoy it. I don't think that the people at CHOA are going to enjoy it, but I do.
Hey, this picture is going to get better ratings than the actual doctor. That's the only thing they're going to be upset about. There are going to be a bunch of people in San Francisco like for a fun time call, and he's going to win.
The only thing that I'm missing over here is a guy in a gimp suit holding the chain. That's that's the only thing I'm missing. Hey, Joe, thanks for the 10. No bingo yet. Dang it. Bingo is getting much harder now that we have all these squares. Is that Scandal Face? No, not quite. He's not pinching the lips together quite enough to make the sex
I think he's
Scandal
too
face.
rehearsed to make that face. He's
Yeah.
so rehearsed.
He's too Botox to make facial expressions beyond looking with his eyes really wide and sort of trying to lift his eyebrows like he's surprised.
That constellation of injuries, right? Because you'd have that squeezing force about the chest that would pull the ribs forward.
Something tells me he
giving you
knows
the
about
posterior rib
squeezing
fracture.
force.
And then you slam down in a seated position, as you're pushing the body down, you're squishing those cans. So you put that axial load.
Oh my God,
on
I'm
the
going to get
spine,
so many letters.
which could cause the
I really don't want to hear this
compression
man say
fracture. So,
load
yes.
in any form.
How often do you see broken ribs and or compression injuries with no petechiae or subdural hemorrhoids, anything else associated with it?
Look, I was uncomfortable when Judson Welsher did it. This is going on our Christmas calendar. You do realize that.
Rogue Mama, stop it. And when I say stop it, I mean more, please, more. Oh God, I'm getting canceled today.
Sure. So blood vessels that can be anywhere on the body. You see those from like a high velocity impact. So we see that with like a slap or being struck with something, causing those blood vessels to burst. A subdural hematoma, that's blood that's within the skull but outside the brain, underneath one of the membranes called the dura
Good
mater.
catch, chat. State lies should be checked off the bingo card with the picked up, squeezed, and on the butt. Like, there's no evidence for any of that. State
Or
lies.
possible stomping
liars.
or apparently doing the butter churn with the baby.
And I want to know how likely the injury is. If you're saying this is happening, okay, so why is it that vertebra compressed and not the rest of the spine compressed? Show me. I'm confused. How do you just squunch one of the vertebrae?
Well, yeah,
and
because
then,
you would think your coccyx would be the bone that was broken, your tailbone, because it would be the first one impacted. Now, additional force would be radiated up the spine, but the first thing having contact on it, I mean, unless he's going to now say that they did the butter churn on the side of the dresser and went for T10 specifically, I don't know. None of this makes sense. Kim Fox, I'm sorry. You are like when you try to buy Kim Possible on Timu. It's just not going to happen.
We see that from rupture of the bridging veins around the brain. So sometimes we see the subdural hematomas if there's a component of the trauma that causes the head to kind of shake around.
Are we bringing up Shaken Baby?
Like an abusive head trauma scenario.
Yeah,
and if in that scenario there was a squeezing force about the chest, we can see them together, but they're from different mechanisms, right?
Yeah,
it's
'cause
not
they do that,
from
they bring up
the squeezing
Shaken
about
Baby,
the chest
even though it's been
isn't going
debunked.
to cause the bridging veins in your head to break and to cause a subdural hematoma. It's not, the squeezing force isn't going to cause the blood vessels on the surface of the skin to rupture in a petechial pattern. So can you see them together? Yes. Would they be from the same traumatic mechanism? No.
How often do you see a compression injury with no internal injuries?
So it's pretty rare that we actually see compression fractures. If you're talking about internal injuries, like to the, this was in the T10, so it's in the thorax, so like to the lungs or to the
squeezing force.
Other internal organs. I wouldn't expect that because you're getting the force is coming down, so you're not having like a blunt force trauma to the thorax to cause that. So I wouldn't expect to see
that's not blunt force trauma
injury from a compression fracture. Now, if there was a different type of trauma that caused that, and there was more significant force to the body, then of course we would see that. But just the compression fracture I was seeing with Jameson, and we did do lab work to check for any other trauma. That's part of our standard workup when we're looking for trauma.
Lab work
and we
doesn't
didn't detect
go
that
for
there was any
trauma.
other injury to like to the liver.
All right,
to the
Rio is
pancreas.
calling unfucking real on the. I'll give it to you. On the, if you have unfucking real on the bingo card, go ahead and check that off. Do I have it? I don't. I have for fuck's sake. That's.
To the kidneys. So that's not unexpected.
You indicated that when you initially prepared for this examination that you reviewed the medical report. Did you note in the medical report that when he presented at CHOA, there was alleged injury under the tongue?
I'll overrule the objection.
Sure. Sorry. So I'm just pulling up. I brought the consult note that Dr. Brown prepared that's in the medical record, as well as my note. So
Might be on page 3 of her report.
yeah, I mean, it even says on the first line of her note that she was asked to see Jameson Timms by Dr. Fleming for evaluation of a facial abrasion, a mouth injury, and multiple healing fractures. So, I mean, it's in the first sentence. And then in her physical exam, it says healing injury to the floor of the mouth under the tongue. So, yes, and I documented that in my note as well because I had reviewed these records. So that's part of my documentation. In my consult note, I quoted, so I copied it out of Dr. Brown's note and put it in there.
You didn't even write your own notes?
In the impression even. Jameson Timms is a 3-month-old with prior history of bruising with concerns for non-accidental trauma, presents with a facial abrasion, mouth injury, multiple healing posterior rib fractures, and loss of height of the vertebral body of T10.
Okay.
So,
did you personally look to see if the mouth injury had healed?
Sure. So when I examined Jameson, that was a few weeks later. So that was on the 3rd of February. And he did not have any intraoral injuries. So there was nothing wrong with the mucosal surfaces inside of his mouth. He didn't have any, his physical exam was totally fine when I saw him. He didn't have any signs of trauma inside his mouth or on his body.
Would you expect the inside of the mouth to heal to the point where you would not have seen that on February 3rd?
Oh, absolutely. So the mucosal
Good
surface
Lord,
on the inside of the mouth.
don't do that with your mouth, sir.
It heals really quickly. Like if you think about
What is going on with his
we've all
mouth?
bitten down on the inside of our
What is
cheek.
What is he doing?
Or if you look inside the mouth, you're not going to see any kind of like scarring.
What is he
So
doing?
it heals really quickly.
He's demonstrating his expertise.
Wait a minute. Hold on.
He's trying to show how you bite the inside of your cheek. Only Jameson didn't have teeth, so I don't know what his doctorology says about a 3-month-old biting themselves.
Why are you doing this?
He's demonstrating his expertise. He knows this is going on the internet. He's shopping.
The mucosal
Well,
surface on
his
the inside of the
expertise
mouth.
But like he's not telling
heals
people
really quickly.
that
Like, if
that's
you
what
think
he's
about-
doing. He's just doing it.
We've all bitten down on the inside of our cheek and drawn blood. Or if you look inside your mouth, you're not going to see any kind of like scarring. So it heals really quickly.
What in the hellfire am I
There was a
watching?
prior injury there.
I'm going to hand you.
Do we still have like awkward faces? Is that a thing?
Weird mouth noises.
Oh, sure.
I think we have.
On State's
I
Oh
think
my
that
God, now he
qualifies.
really looks French.
on State's Exhibit number 1.
I do.
What injury do you see?
Yeah, so this is a photograph of
I don't know why the glasses make it
there's
so
a-
much funnier
a
to
tongue blade, which is like a popsicle stick, in his tongue up, and you can see that there's a tear of the mucosa underneath his tongue. So there's, you can see that there's a
terrible.
disruption
This
in
is
the,
a terrible
the tissue.
idea.
You can see the how it's brighter red around the edges of where that tear is.
Oh my!
And this is a very protected area, so.
What
You know, it's underneath the tongue. You need to get trauma
Keep trying to
that's going directly
demonstrate
there.
mouth things.
Or pushing the tongue up
What is he
to cause the
doing?
injury there. So it's not something that
What are you doing?
Sir,
occurs
stop it.
frequently. When we're seeing traumatic injuries to the face or to the mouth, it's going to, if it's like from falling or striking into something,
I
it's going
like
to
how
be to
he's
the
really
exposed
staying in my
surfaces.
drawing for the
You
most
have to have
part.
something that's going inside the mouth and
I was
under
going
the
to say, he
tongue
doesn't
to
move
cause
around a
that
lot,
tear.
so it's good for the drying.
As a
Well, he knows all about
pediatrician,
things
is
going
there a
inside the
mechanism?
mouth. You got to give him that. It's for his expertise. He's very good
He
about
is an
mouth
expertologist
injuries
at
that
that.
could happen with jamming things in the mouth.
Yeah,
I'm sure he's got lots of
he's a
experience with that.
mouthfeeler region specialist. He should get board certified in that.
That you typically associate with that type of injury in infants?
Yeah, so be concerned about something being forcefully placed into Jameson's mouth, whether that be, like a finger, a spoon, a binky really wouldn't do that unless you use the side of it, like not the squishy part of it, but something that's going to cause trauma underneath the tongue. That's
Cause
any
trauma
of those things
under
would cause
the
that.
tongue.
Is that something that infant would typically do to itself?
Oh, no.
Why not?
Yeah, I mean, we're not going to put something, just like we are, and shove something into our mouth. He was only a few months old at the time. You see infants putting their fingers inside their mouths all the time. Doesn't cause injuries.
Wait, I thought babies weren't mobile and didn't do that.
Binkies, like I mentioned, they're designed just like the nipples on bottles, but they're soft and pliable to not cause injury to the inside of the mouth.
If someone had alleged that Jameson had a alleged collagen deficiency, is that an injury that you would expect to be related to a collagen disorder?
No.
Why not?
So if you had a collagen disorder, I expect where you're going to see the
I love how he
injuries,
settles right back into my
are
drawing.
where you're going to have the most
This guy really does a good
movement
job staying in
and,
the
most
same
impact
place.
with things, right? So like at your joints, not in that protected area underneath your tongue. So you need to have the trauma there to cause that. And so if you have a problem with your collagen, so then that's impacting the integrity or the strength of those tissues. It's not like they're going to spontaneously, tear. You need to have that trauma there. Now, it may require less trauma, but you still need to have trauma.
I feel like he knows
So
about trauma that causes tears.
where that is, you have to have trauma there. I would expect if there was a collagen
This is going to take us
issue,
14
then
years.
you'd be seeing more traumatic injuries to other parts of the body where you're routinely exposed to trauma through handling, through accidental things like maybe bumping into something where you're going to come in contact with that trauma, not inside the mouth.
How many frenulum are inside a person's mouth?
So typically there's 3. So
Jameson,
there's
thanks for the
frenula,
2.
what we
This guy
call the
said, how
labial
many
frenulum.
mouth blunts
There's
and
your
journeys?
top lip and your bottom lip. It's that little piece of tissue
Frenulums.
that connects your the inside of your lip to your gums, and then the one under the tongue is the lingual frenulum. Some people have absence of one of the labial frenula. But in general, there's
He seems so uncomfortable saying labial.
Where is the tear in relation to the frenulum in States Exhibit number 1?
Yeah, so it's right next to it. It's underneath the tongue, right by the lingual.
Please show us that again.
Did you check to see whether or not his facial injury had healed?
I did.
I'm handing you what I marked as
His eczema?
Exhibit number 9.
Really interesting. A pediatrician can't denote or figure out eczema. Oh,
Hypothetically, looking
I'm
at States
totally
Exhibit
going to
number
YouTube
9,
jail for this
is the
stream
injury
bowl
that you
story.
see on that consistent or
It's
inconsistent
going to
with
cause an
someone
entire
grabbing the
new
child's
thread on
face
Reddit
and
about my
taking
homophobia.
the wide part of a thumbnail and rubbing it up across that
You
cheek?
can't
fleshy
be
part of the cheek?
homophobic. You have a lesbian on the channel with you.
Sure.
I
And
know.
that certainly caused this injury.
Flux, you
Seen
are
some
my
bruising,
comeback.
abrasion,
I was
and
like,
that
I adopted a
purple hair.
lesbian.
Right? You're okay. You've got a token with you.
That's why I just take Flux with me to, the San Francisco of Indiana. I'm one of you.
I'm one of you. Puzzled Puzzlers, thanks to the 5. Exactly how is Megan so familiar with those kinds of outfits? Poor Mr. Fox. Well, I'll tell you. I spent 20 years covering conservative news. And in that time, libs of TikTok became a thing. And we all learned way more than we ever wanted to know about that side of the internet. Okay, it's not my fault. Libs of TikTok did it. It's her fault. Also, Jameson 2012, thanks for the 2, says, please, this is junk science as an expert. Well, yeah, all child abuse pediatricians are junk science. All of them. Duncan Idaho, thanks for being a member for 23 months. He's accustomed to a ball gag, possibly. Frankie, thanks for gifting 5 Megan Fox memberships. You're awesome. I appreciate you. And also, welcome to the Fox Den, those of you who got that. It's weird here, as you have learned today, but you will get used to it. Also, there are some super tips. Rylan, thanks for the 5.
If Flux said, you are what you eat, does that make this guy a dick or an ass?
Sir, this man is a limp-wristed marionette for state-sanctioned kidnapping, and I will not sit by while you denigrate his heroic qualities.
State-sanctioned kidnapping. I like that phrase. Thanks, Deb. And Zadi, Addie, thanks for the 5.
I am the judge. Sustained. Shut up. Sit down.
Nice. And we are now going to take a bathroom break because we have been here for an hour and a half, and we need to have, we need to have some tea, and we need a bathroom break. So we will be back in 3 minutes and 30 seconds, I think. Woo-hoo. Yeah. See ya.
She's streaming live, just killing the game. Sipping coffee like it's her middle name. A whiskey splash in her chai tea brew. But now she's squirming, doesn't know what to do. The chat is lit, emojis abound. But her legs are shaking, she feels the countdown. She's got a crowd watching her sway, but nature's call says she can't stay. BRB, gotta fly to the throne. Bathroom break, it's a live stream zone. Don't pause the stream, don't shut it down. She'll be back serving slay in this virtual town. She's a queen with a mug in hand, one espresso shot and she's taking a stand. But the coffee train has come full stop. It's an awkward dance, she's got a hop. The comments roll, where'd you go? Someone says, guess the drinks did flow. The struggle's real, the time is near. Even YouTubers have bathrooms, dear. BRB, gotta fly to the throne. Bathroom break, it's a live stream zone. Don't pause the stream, don't shut it down. She'll be back serving slay in this virtual town. Gotta fly to the throne. Bathroom break, it's a live stream zone. Don't pause the stream, don't shut it down. She'll be back serving slay in this virtual town. She's streaming live, just killing the game, sipping coffee like it's her middle name. A whiskey splash in her chai tea brew, but now she's squirming, doesn't know what to do. The chat is lit, emojis abound, but her legs are shaking, she feels the countdown. She's got a crowd watching her sway.
All right, sorry about that. I just realized that, wait, I gotta plug my thing in, I can't hear. All right, sorry about that. I just realized that 3 minutes was not enough to boil water in my kettle. All right, here we go.
Pattern. So that could certainly cause that.
Hypothetically, were the combination of the tear under the tongue and the facial injury the state has just showed you consistent with someone grabbing the baby's mouth, forcing it open and shoving something in?
Sure, that could definitely be a scenario where you get both of those injuries.
Did you check to see whether or not, well, I want to have you explain a little bit better. As a person who is employed as a child abuse specialist, are you trying to find child abuse or
Yes.
eliminate child abuse in the cases
Trying
that you're
to
referred?
find it.
Well, so I'm evaluating for
They're making shit up.
concerns of child abuse.
Yep.
So when children get referred to my service, so that's at any of the
Your
hospitals,
service.
so Scottish Rite.
Nobody asked for your
used to
services,
be,
sir.
At Eggleston, now it's Arthur M. Blank Hospital or Hugh Spalding, or to our clinic. It's because someone had a concern about some type of maltreatment. We'll do a full evaluation. If there are injuries that are, and findings that are consistent with child abuse, then I will make that diagnosis, as will my colleagues. It's not something that we, it's not a diagnosis that I like to make, but it's necessary because if it's happened, then it's happened. I pulled the numbers. So we reviewed over the past 3 years, 3,526 cases in the system where there was.
JKD Buck has come through with another meme that is hilarious. I have to pull this one up. Oh, solo mio. This is good. This is really good. That's some good photoshopping skills.
That is,
right?
Some really good photoshopping skills. It looks really real. I love it.
A concern of there's some type of trauma or concern of abuse to the infant. And my team did consults in 1,122 of those cases. So that's about a third, 32%. And then of those consults, we diagnosed abuse in 394 cases. So that's of the overall number, it's only 11% of the 3,500 cases. So it's the minority of cases. And in cases where we've actually gone in and done a consult, so those 1,122 cases, if you look at the number that we've actually diagnosed abuse in, 394, that's 35%. So it's the minority of cases. But if there is abuse, then we will diagnose it, and we will document that in the medical record. There have been cases where, we've discovered that there's a mimicker. There have been cases, I can recall a case, it was Christmas Eve, a physician who was in training.
The fake story.
Made a comment to the social worker that this child's fracture was an abusive fracture, which was incorrect.
Fracture?
And that set off a cascade of events.
Like a cheerleading move.
What's an abusive
They were
fracture?
about to remove the child from the home on Christmas Eve. And so I got
On
a consult
Christmas
about that.
Eve?
And
Did you just throw
I
that
intervened,
No, he
explained-
said that before. This is some made up crap story that he's come up with to sound like a hero. So one Christmas
I was gonna say-
Eve. Yeah, did you hear him say a cascade of events with social workers? It's like, yeah, that's what you guys do every time.
Is he trying to be like, oh, they tried to take the baby away at Christmas, but I intervened to
Yes,
let him
because he's a
like
hero,
keep the
Clark.
baby?
Yes, this must be his. This is his made up
This is
fake
his
story.
one time that he disagreed with another child abuse pediatrician, because that's what
I'll take things that never happened for 800, Alex.
Yeah.
I like to use my daily
Yeah.
double points.
Of all the things that never happened, this one never happened the most.
the non-medical folks that this was inaccurate, that this was not abuse.
But hold up just a minute.
Yeah,
What's your
objection.
I have no earthly idea what this answer is.
Ms. Fox?
I think we've gone a little bit of far afield, and
Yes,
I'm gonna
you've
get
gone
rid of it.
quite
My
a
point
bit far
was
afield.
That it's a minority of the cases, and we'll move on.
I'm going to sustain the objection and ask you to move on.
As part of your training,
Stop making
in
up
your
stories,
field, do you learn about other easily missed diagnoses so that you can go behind the person who's made the referral and make sure that a given child doesn't have another condition that might mimic child abuse?
Oh, absolutely.
Okay. In this particular case, did you look into Jameson's vitamin D levels?
So I didn't order that, but it was looked into. So yes, we did get a vitamin D level, or Dr. Brown did.
And was his vitamin D normal?
It was.
Why is that important?
Yeah, so that's important in bone health, and it was normal.
He knows
Did
a lot about
your team
bones.
look into the platelet count?
We did.
Why is that?
Yes, chat sustained. You may mark that off on the bingo card.
Important.
Sure. So those are the components of blood that cause bleeding to stop. They're part of the clotting cascade. So we want to make sure that they're in sufficient numbers in case there was any kind of bleeding that was going on, that it would stop that bleeding. And the platelet count was normal as well.
Okay. What about the lipase levels?
So lipase, that's part of the trauma workup. As I mentioned before, we do labs to look for any kind of injury to the internal organs. The lipase is
Good
looking
Lord,
for
this
injury
direct is
to
long.
the pancreas. So that's an organ that's kind of
10 more
sits
minutes of this
over the
direct.
spine. It's in the back of your.
I'm speeding him up.
In your abdominal
Thank you.
cavity. And lipase
thank
is an
you.
enzyme that it produces. And so we want to look to see if that's elevated. That
too
would be an
much
indication
time.
that there's potentially
He just wants to hear himself
trauma
speak.
to the pancreas. And it was not elevated in Jameson's case.
Were there any issues with Jameson's heart?
No.
Were there any issues with Jameson's skull?
No.
Did his fissures close too soon?
No, so fissures are the normal spaces between the bones in the infant's skull, and they did not close prematurely.
Was there anything about Jameson's medical records that would support a diagnosis of osteogenesis imperfecta?
No.
Why not?
So we did the genetic testing, sent that off to University of Washington. It did not show any abnormalities. There was one variant of unknown significance, which was
So isn't that an
not,
abnormality?
anything that was, what we call pathogenic or would cause problems. And we know that over time we have another set of
Hold
X-rays
on.
from Jameson.
Rogue Mama caught a sex scandal face on this guy. A perfect sex scandal face.
Ooh. Oh my gosh, yes.
And just for reference, we got to pull up our reference material, but I'd say this is damn near perfect. Oh yeah. Yep, you may check that off the bingo card. How did I miss that?
And unknown significant, I guess or significance.
Unknown significance. Yes, we can check that off now too.
Can we say osteogenesis imperfecta since they did attempt to say it?
Yes, we can. So now we've got osteogenesis imperfecta, sex scandal face.
We're using their made-up words. They should use our made-up words.
Yes.
Sex scandal face. And what was the third one I said? Damn it, I've forgotten already.
Ooh, can it be cat fire?
Shit. Oh, unknown significance. Unknown significance. Jeez, I still don't have a bingo, but I'm close.
When he became even more mobile, people who have osteogenesis imperfecta don't outgrow it. It's in your genetic makeup. It's how your collagen is formed. If there's a problem with the collagen, you're going to have that problem. It's a lifelong issue. So when we see people who have osteogenesis imperfecta, when they tend to fracture, they're going to fracture more as they become more mobile because they're getting around more. They're putting weight on those bones. We see the bones actually start bowing in the upper legs, so the femurs, the thigh bones, when they start bearing weight. And Jameson came back for a follow-up skeletal survey, so we actually had a total of 5. And on that 5th one, the bones were completely normal as well, so no fractures. So if there was anything inherently wrong with his bone structure, we would expect to see additional fractures over time as he becomes more mobile, and we did not see that.
I'm glad he's somewhat speaking normally now.
Was there anything
with,
about
whatever
Jameson's medical history in your physical exam that would support a diagnosis of Ehlers-Danlos Syndrome?
No.
Why not?
Yeah, so, you can't make a diagnosis of Ehlers-Danlos Syndrome in someone his age. He's too young. All babies are pretty bendy. So if you think about little infants and they can put their feet up by their head.
Bendy babies, medical diagnosis, medical term.
Their soft tissues are at that age. But there's not anything to suggest that he has anything wrong with his connective tissues, such as Ehlers-Danlos.
Even if he grew up to have a diagnosis of hyper-immobile Ehlers-Danlos syndrome, is broken bones a diagnostic factor for that diagnosis?
No, it's not. So when people who have Ehlers-Danlos, when they get fractures, it's because they have unstable joints, and so they twist their ankle and fall. One of the things that they do for patients with Ehlers-Danlos is they have them do physical therapy. And you wouldn't be doing physical therapy if that was, going to cause them to fracture. So no.
Was there anything about Jameson's medical history or your physical exam that would support a diagnosis of Cole-Carpenter syndrome?
No.
Why not?
So that's a very rare genetic condition, very particular facies. So what happens is the sutures will close prematurely, causing the skull to be malformed, something called craniosynostosis. Eyes will be kind of like proptotic, or they're kind of bulging.
Okay. Someone just sent me this.
I love it. I would totally watch this trial.
You are watching this trial. You are literally watching this trial.
But he didn't wear his superhero suit or the leather daddy outfit, and I feel like I've been cheated.
Oh, thank you for that, Optopit. I appreciate that. That was hilarious.
Out. Like a triangular face. So there's
Grok
nothing.
is trying its hardest,
you know,
but
that,
it's really not working out so well. Let me show you what Grok thinks a leather daddy is. This just looks like a. This is not a pride parade. This is
no. That's just like an action movie, dude.
Yeah, this is a
That's
biker
Snake
who
Plissken.
wandered into a union protest. Like what?
He's like,
the
am I
hell?
allowed at MAGA? And they're like, hell yes. You look kind of like Snake Plissken. And he's like, oh, yeah, that's who I look
Did
like.
he parachute in? Like, this is the wrong kind of outfit, Grok. Grok is like very concerned with modesty, I think.
Free the male nip.
On his physical exam, that would suggest that. And he hasn't had any additional fractures.
Was there anything about Jameson's physical exam and his medical records that would support a
Why
diagnosis?
does he give her the Kubrick stare?
No.
Why not?
So there is not a temporary brittle bone disease. That's a hypothetical construct that's been disproven. It's not accepted in the medical community. It just doesn't exist.
Was there anything about Jameson's physical exam and medical records that would support a diagnosis of metabolic bone disease?
No, so we did the metabolic workup and everything was fine.
Hypothetically, if Jameson's mother took ferrous sulfate, which is an iron tablet, when she was pregnant with him, would you expect that to have an effect on his bone structures and collagens and things of that nature?
No.
Why not?
Very common for obstetricians to prescribe iron to pregnant women who have an anemia.
Oh, for fuck's sake!
It doesn't have.
No.
That doesn't make it safe, for one. Two, that's not the kind of doctor he is. It's a ridiculous question to him. It's a stupid answer.
Not only that, but if you do have to take iron, it's more expensive, but take the gentle iron. I think it's called gentle FE, because iron typically is the component in prenatal vitamins that causes the most stomach issues. And it doesn't matter if you take it orally if your body can absorb or use it. So Carrie's levels could have gone up and, gone out of the anemic range. But if her body is not able to isolate that iron, it's not going to do anything. It's just going to hang out in her blood and not be bioavailable.
Yes,
I'm
for
not a
fuck's sake, it's on the
doctorologist.
bingo card. Make sure you check it off.
Any kind of teratogenic effects to the infant. So no.
Hypothetically, if the mother took metoprolol tartrate while she's pregnant, would you expect that prescription to have an effect on the baby?
So if I'm understanding you correctly, metoprolol, which is a beta blocker for blood pressure, no, I would not expect that to have any kind of effect on the baby.
Why not?
So as far as, it wouldn't have any effect as far as like the bones, the collagen integrity. It can cause a low heart rate, so bradycardia, which it does in all of us who would take it, including a fetus. It can cause the blood sugars to drop, but it doesn't have any effect on the collagen or the bony structure.
Hypothetically, if the mother took ondansetron while she was pregnant, would you expect that prescription to have effect on the baby?
So that's Zofran, again, another common medication for pregnant women to help with nausea. The side effects from that would be things with like a neural tube or like a cleft palate, nothing that has to do with the bones or the collagen. So no.
Hypothetically, if the mother took ibuprofen while she was pregnant, would you expect that prescription to have an effect on the baby?
So ibuprofen and NSAIDs are not really recommended for pregnant women who are like in their third trimester, because it can have effects on the baby.
Tell that to the women on TikTok.
I was just about to say.
Well, also, I mean, again, listen to your doctor. But so you've got a medication that causes the baby's heart rate to slow and possibly its insulin levels to crater. But it's okay because a doctor prescribed it. The, other one causes cleft palates and neural tube, issues, but it's totally okay. Again, listen to the man who's trying to say the science is totally, settled and this is fine, but then listing off all of the things that can come from this. Are you telling me that Big Pharma maybe hasn't released adverse effects about some of its medications that they've been hawking to pregnant women?
But not on the bones. So no, I mean, we can have side effects, like I said, to the kidneys and the heart, but not to the bones.
What is a clinically well child?
Excuse me?
What is a clinically well child?
Clinically well. Sometimes we'll see that in the medical record. If we document, like under our physical exam, that the patient is clinically well, that means that they're not in any kind of distress. That
Trying
they're
to
not,
fix
like a
Verena's
critical
mistake.
condition, that they appear to be in a well state. So that's just a way that we will document that. Typically, it's under general when you're looking at the physical exam in the medical records.
Is it mutually exclusive of also having been a victim of child abuse? Can you be clinically well and still be a victim of child abuse at the same time?
Sure.
Why?
Yeah, so I see patients all the time who I've diagnosed with child abuse, and they appear well because I'm seeing them after the fact, not during the incident. Sometimes those patients are not clinically well. They're in the intensive care unit on a ventilator. But if you had, at the time, if like in Jameson's case, when I saw him, he was clinically well when I saw him. All his vital signs were fine. He appeared completely normal. It's because time had elapsed. I didn't see him at the, in distress when those fractures occurred. So that's completely normal, to document that way, to have that physical exam finding in a child who had been previously physically abused.
After examining Jameson and reviewing his medical history at CHOA, that would include the 3 broken ribs, the compression fracture, the cut under the tongue, and the abrasion to the face. Is the injuries on Jameson Timms consistent or inconsistent with a finding of child abuse?
Yeah, consistent with child abuse.
Why?
Sure. So as I mentioned before, there was no trauma history to account for the totality of these injuries. There are multiple injuries, skeletal, cutaneous, mucocutaneous injuries. And all of our workup did not reveal any kind of propensity to these type of injuries. So you need to have that trauma. And I've yet to hear a trauma that would account for all of these injuries, and he cannot self-inflict these injuries.
I have one other question about the compression fracture on T10. Could that have been a birth-related injury?
No.
Why not?
So in the birthing process, you're not kind of pushing the baby together. If anything, you're helping to birth the baby. That's why we see these kind of injuries to the extremities if someone pulls on the arm or the leg. So you're not getting a compressive force on the body. You're getting like an extraction. So no.
You're a witness.
Good
This
morning, Dr.
man knows
Messner.
about the
Good morning.
birth canal how? Other than
Jameson,
being
Well,
near
I'm
one once in his
thinking,
life.
Your hospital.
Isn't it a squunching when like the whole body is trying to come out and like, the baby's having trouble, so its whole body's, being, am I stupid? And like, that's not how stuff works?
I don't know. I can't tell you at this point. I'm
Because
confused.
we use the word contraction, meaning contract, would be synonymous to compression, compressions or, oh my God, he's such an idiot.
Like, I've never given birth, but
I'm
sometimes
just
I'm
glad
like,
Fox is done. I'm so tired of hearing her voice with her questions.
I know,
yeah,
I'm sick of
Brassy
hearing her
Locks is
too.
annoying.
Can't stand it.
In January of 2022. Is that correct?
That's correct.
And you did not interact with Jameson at that time.
That's correct.
And your interaction with Jameson, as I understand it, was limited to one event on February the 3rd of 2022. Is that correct?
That is correct. Yes.
And you indicated that present with the child that day would have been at least one relative, a lady by the name of Brittany. You recall that?
Carrie's
yes,
here.
He came to the clinic with Brittany and Brittany's mother, Renee Timms.
Okay. If I indicated to you
Well,
that,
maybe. There she is.
well, strike that. Yes.
Hi, Carrie.
Renee Timms was also present. Is that
How you doing today? Oh, I don't know if she can hear me yet.
right?
That's correct.
Did you speak with both of them?
I did.
And you are not a radiologist, correct?
That's correct.
You are not a geneticist.
That's correct.
Your testimony, your opinions on those issues are at least somewhat informed by your consultation with folks who are radiologists and who are geneticists. Is that correct?
Yes.
When Jameson came to you and you evaluated him, you made what you would refer to as a note or a record of that event. Is that right?
That's correct.
And do you have that with you?
I do.
can you guys hear me now?
Yes.
The record indicates
Werther's break.
that
The judge is taking out the
or
candy.
notes or reflects
We actually get to see it this time.
was
Normally
in
we
the
just hear it.
review
We got to see it
of
this time.
photographs
So
by
exciting.
Dr. Brown. When your note says Dr. Brown, is that Verena Brown who testified in this case?
Dang it, I don't have it.
Where does it say that in the note?
Can I approach the witness?
You certainly can.
make sure we're looking at the same stuff.
Sure.
What was the question? Are you just reading from Dr.
It does,
Verena
yes.
Brown's notes?
So that paragraph, I am about halfway down.
Oh, that's correct. Yeah, so that's Dr. Brown, my colleague, yes.
Okay. Your record indicates
At
that
least he doesn't cough into the microphone.
there was
True.
There was a history.
All right, so we have two positive things about this witness: good hair and doesn't cough into the microphone. Those are good
but
things.
did he have to lean so far away to make like it obvious? Like,
Well,
He's
the
a
demon-
gay man.
the
He's got to
demon is-
be as extra dramatic as possible.
The demon is being confronted by the man of God at the moment, and so it's trying to get out so that he had the extra movement. The demon is trying to get out. He's trying to keep it in, but it's on its way out.
That were evaluated at Erlanger when he was 6 weeks of age. And it indicates that Dr. Brown's review of those photos indicates that they were also indicative of child physical abuse. Did I read that correctly?
You did.
Okay. Did you ever look at those photos?
I believe so, yes.
And the assumption or the conclusion that what was pictured in those photographs were bruises informs some opinions that were made after the review of those photographs, correct?
Blink
It
rate
didn't
anomaly.
inform
Blink rate anomaly. Look at him. We have another sex scandal face.
I'm calling it awkward.
Awkward pause.
Awkward pause face.
Blink rate
Bingo.
anomaly. Yep. Blink. Where's blink rate anomaly? Oh, I don't have it on this one. But yes, blink. Oh, yes, I do. Yes, I do. I have blink rate anomaly. Okay. Awkward pause, blink rate anomaly, and if you notice, like the demon is trying to get out. Watch, it's trying to get out. There's all kinds of eye rolling now and like weird head movement. And, like, yeah, he's getting uncomfortable.
oh,
Look at
he's
him.
getting so sassy. Also, could you not do the Kubrick stare? It's deeply unsettling. Could we not do it?
opinion. Did it inform Dr. Brown's opinion? Potentially. I can't really speak to that.
Okay. And Dr. Brown's opinion informed your opinion because she met with Jameson when he came to
Did
the
she
hospital
talk
in
to
January.
the
and you
sentient
did not.
body of Jameson?
No. Well, I was able to
No?
review her notes. I
But
did
her
not
notes
meet
were
with
the
him,
only ones
correct,
you fucking read.
during his initial hospitalization. But I was able to review all the documentation, review the workup. So I agreed with her impression.
Okay.
Oh my, he's getting his
It would be
head
fair to
swivel
state,
going.
based upon
He's getting
your note,
sassy.
and you drafted this note, correct?
I did, yes.
That Dr. Brown made the assessment based upon looking at photographs of what
He has
she
moved
described as
slightly after
bruises
my drawing. I'm
on this
upset.
child at Erlanger in November of 2021 were indicative of child abuse. That's what you wrote.
That is what I wrote, yes.
Okay. What if those weren't bruises?
Could you tell me what they were?
You're the
A
doc.
pathologist testified yesterday that they were not bruises.
Holy shit, sassy!
Do you have
Okay,
any basis
Flux,
to
I'm with
disagree?
you. This is too
Oh.
sassy and dramatic.
Oh.
I'm done. I am done with.
Watch this face.
That
Watch
face.
this.
What they were?
A pathologist testified yesterday that they were not bruises.
I want to choose Violet right across his face.
Do you have any
I need to say
pathologist
it
testified
again
yesterday?
What they
and
were?
again.
A pathologist testified yesterday that they were not bruises. Do you have any basis to disagree with that?
Well, I'd like to know what that was based on. I'd love to see.
You read the report.
I was.
What was the rationale from that pathologist about why
The
they
medical
were not
science behind it?
Well, bruises don't appear and disappear within 48
What a
hours.
bitch.
to begin
Yes.
with.
We should have checked
Would
that
you
off a
disagree with
long time ago. I'm sorry,
Yup.
chat. I'm sorry, chat, but what a bitch. Yeah. Damn, that's not on my card.
Oh.
He's a
All right,
bigger bitch than the other bitches that have been on the stand.
He's the biggest bitch we've seen yet.
He has
This is-
already reached level
told
of
you.
mega mecha thunder cunt, which is usually
Oh,
an
the
only
C word.
female, only a female designation. But
Not today.
he is. You have broke the glass ceiling, sir. We applaud you.
So what a bitch and the C word all at the same time. How lucky are you, chat? We've got, if you are just catching up on the bingo, we have Megan hits the wrong button, awkward pause, osteogenesis imperfecta, unknown insignificance, fake words. Oh, no, sorry, we didn't do fake words. Witch sighting, bird talk, for fuck's sake, free space, blink rate anomaly, overruled, sex scandal face, sustained, the C word, state lies, Megan snorts, hair talk, Flux is gonna get angry, thug judge, invade Canada, bendy baby, making shit up, Flux pets cat, unfucking real, Werthers, and what a bitch. And I still don't have bingo. Just how is this even possible?
I'd say in general, they typically last longer, but it all depends on where the bruises are, the amount of blood that is there, the blood supply to that area of the body. So
If his testimony was that what he saw in those photographs appeared to him, in his expert opinion, to be more in line with some issue related to weakness of the blood vessels, connective tissue.
Okay.
Oh, what
Would
was
you have
that
any basis to
bitchy
disagree
smirk?
with that pathology?
Yeah, it's time for our
Sure.
two-finger salute, Flux.
His voice
Based
dropped
on-
like
This-
6
Okay,
octaves.
so if you have
Also,
weakness
this
in your blood
affect
vessels
of taking your glasses on and
and you're
off
attributing a
is
Yeah,
retarded.
why is he doing that? He wasn't even reading anything.
And
These are
he's
fake
smarter than all
glasses.
of us.
Not gonna lie, I
He's
feel very Sally
questioning-
Jesse.
He's questioning another expert. Like he doesn't have that. He doesn't have that kind of training in all of his trainings to question this other doctor. You know, but look how quick he is to do it and to make smug facial expressions that he doesn't agree.
Mm-hmm. Mm-hmm.
What a bitch.
What a bitch. I'm getting backed up on super chats, which is always a good thing.
Yes, because we need the Verena music video.
We do. Rogue Mama, thanks for the 2. I may have demonetized your stream. Check DMs. Yeah, that's why I haven't shown the other photos, Rogue Mama. I'll show them if we go to Rumble. Liz Bird, thanks for the 5. Rumble exclusive money. I would also like you ranting MV over that god-awful interview. MV? Oh, right. Volmet. Mickey Volmet. Sure. That's probably going to be tonight. On my stream with Tug. Puzzled Puzzler, thanks for the 10 in support of demonetization humor. I love it how you guys have my back when I get in trouble with YouTube. Rosilla's Realm, thanks for the 5. Hope you got the link to my latest song, Megan. I did. I haven't had a chance to listen to it yet, but I did get the link. Puzzled Puzzler, thanks for the 2. Sir, why the long face? Puzzled Puzzler, thanks for the 5. If the baby is being pushed out, that would be compression. If birthing was an extension process, babies would be falling out all the time. Yeah, right. Jameson, thanks for the 2. Megan, I'm having to post in locals. Okay, I'll check locals. I have the locals live chat open. And
That's a good sign.
This is the way I've always imagined Perrault, to be honest.
oh my God, that's so funny. And look at the AI rendition of us in the corner. It's so bad. Hold on, let me.
That's a little terrifying. I love it.
Look at this. We have to zoom in because these two people look nothing like us.
Flux, what happened to your
What in the actual
face?
hell is happening here?
I don't know what happened.
It got my background better than it did my face.
Yeah, they made
Jeez.
you look like Tim Pool, Megan,
I
and
was
they
gonna
made
say it's like I feel like this if this was two high school boys doing this type of thing, this is what's happening. It turned us into high school boys.
Wayne and Garth.
I can't. God, this is so funny. Oh, thank you for that, Jameson. That's a good time right there. That's a good time. Oh,
Based
you
on-
glasses.
Okay, so if you have weakness in your blood vessels and you're attributing a bruise to that, then how can you account for the same individual who has the same DNA at the time of those bruises that were seen, healing well after a circumcision, not having excessive bleeding from any kind of puncture of the vessels when you're drawing blood? So to draw that conclusion, I would say, is not accurate.
Okay. If he testified yesterday that he was well aware of those facts and they did not change his opinion whatsoever, would that surprise you?
It would, but that's his opinion. That is not my opinion.
His opinion as a trained pathologist, not your opinion as a pediatrician.
So a pathologist speaking about photographs of bruises versus a pediatrician speaking about photographs of bruises, I really don't see the difference.
What? You don't see
What?
the difference between a pathologist who's an expert in blood, an expert in bruises. That is
on
his
poppers?
specialty. You don't see the difference between a pathologist and you, or you who is a specialist in fake science?
You think the jury got it?
No. What was the jury
No.
doing at this point,
I
Jennifer?
don't know. It's ridiculous. He sounds
I mean,
so
at this
stupid.
point, if I'm on the jury, I'm not listening to anything this man is saying, and I am simply having a tally of see you next Tuesday moments and glasses go on and off. I'm tallying that.
Yeah, literally from the moment he sat down, if I was the jury, I would hate him and I would just be writing down, he's an idiot about this.
Okay,
He said
Flux, if
this,
I
which
ever get
makes him a
charged with
moron.
anything, you're my jury specialist.
Oh, the chat just pointed
Probably
out
a bunch of stick figures with dicks in their mouses would be on my notepad.
Pretty much. I already said in private chat that he's gauged to plaid levels on Spaceballs. He's gone straight to plaid.
Evita, thanks for pointing out that I do have bingo with Thug Judge. I missed that on my bingo card, so now I do. I have bingo. And Puzzled Puzzler, thanks for the 5. That's not my specialty, but they're obviously wrong and not as smart as me.
Right.
Exactly. Rosilla, thanks for the 2. Someone put him in the Blue Oyster Bar. What's the Blue Oyster Bar? I don't know what that is.
It sounds familiar.
It sounds like a...
Is that like a gay bar I don't know about?
It sounds like a
Probably.
gay
Let me
bar.
look it up.
Yeah, look it up. I don't know what
is
that
it
means.
a horrifying double meaning, like I'll go on Urban Dictionary and find out the blue oyster is something horrific and not legal in like 27 UN countries?
Yes, let's not do that live in case I really am going to get demonetized
Well,
for
could you explain it to me?
forever.
Just asking you. You don't see the difference.
Awkward smile. What the fuck?
Do you recall
This guy is delusional.
when Brittany and Renee Timms were in your presence on February the 23rd, having a discussion with them about the rib fractures?
I do, yes.
And do you specifically recall telling them that in terms of the evidence of the fractures, the posterior reaction, the callus, that you would expect to see that for months in those images?
I don't have that documented in my note. So I can't state that with any degree of certainty. As I stated earlier, when bones heal, it takes time for them to develop the callus, and then it takes time for them to completely remodel. And that is under the, that's of the time frame of months. So I wouldn't be surprised if I said that.
certainly possible that you said.
Sure.
Okay. And
What?
your note on February the 20th.
All right, I'm sorry. I can't play the music, but Flux just sent me this. This apparently is the Blue Oyster Bar.
Oh, I now have to go watch Police Academy. Is it the original one?
I think so.
He would
If
fit
someone
right
could-
in with his leather.
If someone could edit his face in, that would be hilarious.
February the 3rd of 2022 indicates, and again, I'm assuming that this is informed by a radiologist with whom you consulted, that the rib fractures have completely healed as of February.
That's correct.
Okay. So evidence of the fractures can be present for months, but in February, they're completely healed. Am I reading that correctly?
You are, yes.
Would it surprise you to know that a pediatric radiologist has offered her opinion in this case that the tiny rib fractures that were present in Jameson could very well date back to his birth?
Oh,
that would be shocking.
Oh,
Yes.
Oh.
If a pediatric radiologist said,
oh,
This
oh
guy.
my God. The smug snorting in the microphone. Oh, the scoffing.
And Megan, I'm just going to go ahead and tell you guys, whenever it comes to the pediatric radiologist, the defense team calls, your viewers will want to listen. This woman has a CV that's like 48 pages long. She will testify for both sides. She is amazing. She is honest. She is truthful. She will educate so many people if they will come back and listen on that day. So for him to even do this is so gross because she's so educated and smart.
I love that he actually, if you guys don't understand that, one thing that we're doing here is I'm trying to do the state's case all at one time, but on the actual trial, Stephen Messner testified last. So he actually testified after the defense witnesses had already gone up. So imagine how much worse he looks to the jury after the defense witnesses, defense experts have already destroyed these theories.
Yes.
And he has the nerve to get up there and be like, well, I mean, honestly, this is the worst look.
I was gonna ask because he at one point he said, you know, the pathologist yesterday said yada yada. So I was like, oh,
He
went out of
testified
order.
last because it did go out of order because of a couple of traveling doctors, and this judge was really trying to accommodate all witnesses, which I appreciated. But supposedly Stephen Messner's father passed away, and he needed to attend the memorial service, and it got pushed so far. So he ended up being last, which I think was very convenient for the state. But it still worked out great for Carrie and Brady, obviously.
I actually think it worked out. It would work out better.
It makes him look so stupid.
So stupid after.
Yeah. And that's the thing. I mean, everyone knows that your pediatrician doesn't look at ENT stuff. They send you to, you know, an ear, nose, and throat doctor. They don't, you know,
Well,
take
remember,
care of.
this pediatrician, you can't make an appointment with him even if your kid does have a sore throat or a hurt ear. He doesn't do that. This guy does not look at sore throats or hurting ears or bellies that hurt. He only looks at children that have allegedly been abused. You're not calling this man and making an appointment with him as your child's pediatrician. So you have to remember that too. His specialty is no specialty. He doesn't even know what a sick kid looks like.
Right. He's not looking for illness. He's looking for abuse.
But yes.
Would it surprise you to know that this particular pediatric radiologist is one of the authors of the board exam for pediatric radiologists?
I don't care.
Oh, you
what
don't
that pediatric
care?
radiologist is to make a statement that you have
I don't
rib
care.
fractures dating back to
bitch.
birth that are not present on 2 studies at 1 month and 2 months. That is
He's the one who
nonsensical.
said you have to
That is
go
not
back.
how our bodies heal.
and redo a skeletal
Yeah, wait a
survey.
minute.
Because
that
sometimes
you
you
start to
can't
see
see them.
Yeah, he's the one that says you have to go back and look because sometimes we miss
reason we
them the
do
first
this
time.
2 weeks later is in case we miss the tiny little
That would be
fractures.
conflicting testimony, folks. If you have conflicting testimony on your bingo card, you may check that off right now because that's a conflicting testimony right there.
Can we
What an
collectively
ass.
call all of his direct a dumpster moment? Just because of his attitude is flaming.
Yes, I think we can.
Yeah.
I'm going to give it to you. So
Thank
you may
you.
also
I now
check
have
off
bingo.
dumpster moment. way to
Oh, this guy's pissing me
manipulate it there.
In 7 to 10 days. By 14 days, definitely. So to say that they're from birth, then no, that doesn't follow any logical sense. Anything that we know in medicine, anything that we've been taught that our pediatric radiologists, experience. This is why we do the follow-up skeletal survey in 2 weeks, is because that gives you the time to see those, the healing. So that first set of x-rays was after he was 2 weeks old. So we're outside of the window. You can't attribute those to birth trauma.
So that expert is incorrect in her assessment.
Yes.
Would it surprise you to know that that same expert and an orthopedic surgeon who have reviewed the images said that there is no compression fracture at T10?
No, it doesn't surprise me, no.
In fact, your note in talking about the compression fracture uses the word likely, does it not?
So it says that on the initial skeletal survey, and this is why we do the follow-up skeletal survey. So where it says likely is under the first
Awkward pause.
Okay, so the impression from the radiologist on 1/14/22, which was during the hospitalization, it says loss of height of vertebral body of T10 suggesting a compression fracture, or likely. But then when we repeated that skeletal survey on the 3rd of February, it says the compression fracture T10 again noted. So it was validated on the follow-up skeletal survey.
Well, hold on. Let me re-ask you my question because you're not answering it. Your note indicates, in reference to the phrase compression fracture, uses the word likely. Does it not?
Do 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 do. Holy shit, he's still going. Wow.
I'm not seeing that specific language in my note.
You certainly can.
What an ass.
Okay, so that's in my impression. Correct. So that's what I just explained about it suggested a compression fracture during the hospitalization. So the exact language in my note was that sentence. During the hospitalization, Jameson was found to have healing posterior rib fractures of the left 8th, 9th, 10th ribs and a likely compression fracture of the T10, as well as injuries to the inside of his mouth, sublingual, his face abrasion, and back bruise. That's the context of that likely, which I explained was confirmed on the follow-up skeletal survey.
And later on, there is a reference to a compression fracture in this same note, talking about a specific vertebral body. And
Okay.
which vertebral body is referenced in your note?
T10.
Keep reading.
The repeat skeletal survey from today shows compression fracture of the T10 vertebral body and no other fractures. Parentheses, the rib fractures have completely healed, end parentheses, period.
You don't have a note in front of you that references a compression fracture of T11?
I do not.
Can I approach, Judge?
You certainly can.
Oh boy.
This dude is being an ass
Bullshit.
on purpose.
Okay, I see that. So that is not the official note. That was my note from a few minutes prior to me signing off on this note. And I picked up on that error, which was me typing.
Oh no, he made an
It's one
error.
vertebral body off. It really doesn't make a difference. But
what?
It even says, if you read my Visic diagnoses, it says compression fracture T10 vertebra with routine healing. So it was a typo on my part, and I actually caught it right away.
Nobody
and this
cares.
is in the official final record.
Quiet,
so
quiet,
I typed
quiet.
11 instead of 10, but I did correct it.
Nobody cares.
But it's still one vertebral body.
You indicated
Yes,
to Ms.
any
Fox
vertebral
that
body can be one vertebral body. Thank
your
you,
role
genius.
was to evaluate.
You're a doctorologist.
Yeah, I'm
going to
go ahead and
this.
chat. You may check off defensive body language on the bingo card. Defensive body language.
Whether or not there had been abuse. Correct?
Correct.
This note, in its last sentence, contains a finding by you that says everything you're looking at is consistent with child physical abuse. Is that correct?
Correct.
All right. So we've already established that you have more expertise in pathology than a pathologist and radiology than a radiologist. So let's talk about genetics.
Oh, did you see the eye roll? Did you see that eye roll? What a bitch! What a bitch! What a bitch! Watch.
Pathology than a pathologist and radiology than a radiologist. So let's talk about genetics. What were the
That was the
results?
gayest eye roll I've ever seen.
Two. There were two eye rolls. Did you see them? Two. Watch
Established
this.
that you have more expertise in pathology than a pathologist and radiology than a radiologist. So let's talk about
One.
genetics.
Two.
What were the results of the COL 1A1 and 1A2 tests at the time that you wrote in your note? Everything you're looking at is consistent with child physical abuse.
Sure. So those results were still pending?
So you didn't know.
Oh.
That's correct.
Okay. So
What a bitch.
you knew blood had been drawn. You knew that it had been sent to a lab. You knew that it was being tested, obviously for some relevant purpose, correct?
Get
Glasses
squanched.
off
Correct.
again.
Correct.
Get squanched.
But you didn't know the results of that test.
That's correct. But we did have the follow-up skeletal survey.
You had no genetic test results, and already you folks are putting in writing,
Yep.
this child has been physically abused.
Yep.
That was my diagnosis. That was Dr. Brown's diagnosis, yes.
No need to wait on those genetic tests. That came back with an abnormality at a site that produces connective tissue.
Yep.
Correct?
Stop laughing,
So there
you
is
bitch.
a variant of unknown significance that was
Oh, here we
detected.
go.
It's a non-pathogenic variant.
He
It
thinks
was
he's
detected
telling
in
everybody.
two other individuals when I reached out to the lab who are related
I hate
to
this guy. Like, I hate him. Is there a bingo from I hate the witness? There ought to be. My God, I hate him.
You imagine
You're
this
so
guy
smug.
after this trial walking up
Oh.
to Carrie at another trial, and you see what I'm saying about saying,
Yeah.
"Oh hi." Just
Oh, hi.
imagine why he did that. He's such a jerk.
Oh my God. I'm sorry. I hate this guy. I hate him. Like, I can't find the words.
It's the utter disrespect he shows professionals in his own field. So you know that if he has no respect for professionals in his own
Yes.
field, this is
He has
exactly
zero
what he does to
respect for
parents. So
he has
when
zero
Carrie-
respect for parents. Yeah.
when
He
Carrie
doesn't
was
respect
probably
a
trying-
pediatric radiologist or a pathologist. He sure as shit doesn't respect you or
Exactly.
a plumber or a teacher or no.
We're all beneath him. Everybody.
Mm-hmm. God, he needs this right everywhere he goes. This needs to be playing.
What the fuck? Bitch, what the fuck? Bitch, what the fuck? Bitch, what the fuck? What the fuck? What
We should follow him around with a boombox with that playing. This guy is unbelievable.
Jameson, they do not display any kind of signs of OI.
Says who?
And Jameson, that's my understanding.
Says who? Who did you talk to that said that?
That said what?
That they
That
didn't
there's
have
no
any signs.
What do you
of
mean?
OI.
Join the conversation with us.
According to the
Yeah, who did you talk to? Who
records
said
and
that?
my discussions with counsel, there's not a family history of OI.
Did you
Discussions
have
with
conversations with counsel 3 years ago?
with the DA's office when we were preparing for this case? I was told.
So your information about the genetic history in this case comes from the district attorney's office. Is that your
Well,
testimony?
I'm telling you the current information. During the evaluation by Dr. Brown, she said OI screening questions were negative, other than the grandfather with poor dentition. So there's not a known family history of OI. There is this variant of unknown significance. Jameson has not fractured additionally since these
What is
initial
that
fractures, yet
face?
he's more mobile. That is not something that you see in OI. So
That's not even accurate.
my diagnosis remains unchanged.
Okay.
The judge is getting that word there's break on again.
That's correct.
You define that as non-pathogenic, correct?
That's correct.
Define the word unknown for me. Give me your definition of that word.
Oh, I love
Sure.
this.
So not sure of what that of what it means. So it's an unknown significance.
You don't know what the word unknown means?
I just explained it. So it means we don't know.
Okay. Less than certain, correct?
Well, the word unknown, yes.
So variant of unknown significance. We don't know the significance of this variant.
Well, we do to an extent where it's been detected in other individuals. The vast majority of them are of African American descent, which is obviously not what we're seeing here with Jameson and being Caucasian.
Oh, he's right on that.
We know that so when they say that it's unknown significance, it's it's on that same.
He hasn't had the genetic testing. How does he know?
It's close to where
Okay,
we
I
see
literally
pathogenic.
just did genetic testing, and there was a found thing of unknown significance, and they explained it to me as we don't know if this could be causing something. It might, but we don't know. So how do they get around being like, well, unknown means they don't have it?
Right.
What? That's not what it means.
He's just said
And
it
any
3
geneticist,
times.
they might say to you, we don't think this is causing anything, but we can't be sure. We can't be sure. We don't know.
Right.
Because this is an unknown. It's unknown. Duh.
Changes in the genetic makeup, but it's coding for like the mRNA. In this case, the proof is really in how does this get expressed in this human being, and if it's being expressed in a pathogenic way, where you're seeing that it's causing problems with the collagen that is causing him to fracture more, then he would be fracturing more, and he's not. So,
well, let me stop you because I didn't ask you any of that.
I didn't ask you any of that. Right.
If
Shut
a
up.
pediatric geneticist has testified in this case, that in her opinion, what has happened with Jameson is not necessarily inconsistent with a diagnosis. If, in her opinion, what has happened with Jameson, the course of these events, is not inconsistent with the diagnosis of a connective tissue disorder, and in fact, has diagnosed him with a connective tissue disorder.
Your Honor, I object. We had 2 geneticists and neither one of them diagnosed him with anything.
Mr. Hood?
I think Dr. Krishnamurti did. I think she said that, in her opinion, he had an undefined, unspecified connective tissue disorder.
Yes.
I would agree. She said she would have to do more testing to diagnose him with anything.
I'll overrule the objection that it's for the ladies and gentlemen of the jury to recall the testimony of the witnesses they've heard.
If that was her testimony, is she incorrect about that?
Well, I'd like to know what the testimony was and what it's based
sure you
on.
would.
But my opinion is based off of what I know Jameson's body has done in the intervening time. In between those skeletal surveys, there have been no additional fractures. So
if more than one witness in this case has testified that in connective tissue disorder situations such as OI, there is a wide spectrum that you can see in terms of very, very mild with very, very few fractures or no fractures to very, very severe, and to cases where fractures happen early but seem not to happen as consistently over time. Would that surprise you?
no.
This guy. So why can't it happen with Jameson if it doesn't surprise you?
Based upon your review of the records, there was no indication of any internal injury to Jameson at any time. Is that correct?
That's correct.
And when I use that phrase, doctor, I'm speaking of soft tissue or organ damage. Is that correct?
He did not. That's correct.
Okay. No bruised or damaged organs.
That's correct.
Which
He did
seems
not
impossible
present
with a squunching.
to CHOA in January of 2022 with any bruises on his torso.
If I give you a good
bruise
squunching,
that was
it's going to
located
bruise.
by his mother after he was x-rayed on his back.
So limited to the torso, that's correct. There were other findings which we mentioned earlier, or I did.
And you mentioned an abrasion to the face. Is that correct?
Correct. There's correct with some surrounding
Studying the
bruising. Yes.
photo.
Right? I'm like, did he just pick up the photo and like look at it?
Yes.
Yeah,
Ms. Fox asked
definitely
you
an
about some
abrasion.
blood test results, and you indicated at one point that Jameson's vitamin D level was normal. Is that
That's
right?
correct. Mhm.
We don't know what his vitamin D level was on the day that he was born, do we?
I don't know.
You don't know any lab results for Jameson on the day that he was born. Is that correct?
No, there's some lab results like his blood type, et cetera, but not, any vitamin D level. They wouldn't routinely get that, no.
Well, they should.
Let me study this picture for the
All
vitamin
right,
D level
thank you.
real quick.
That's all I have for you right now. Ms. Bernard may have some questions.
All right.
Thank you, Mr. Hood.
We
Ms.
are
Bernard, do you have questions?
At the moment where we're going to leave off for tomorrow, Miss Bernard's cross-examination, which will be epic, I am sure. Let's hit the super chats, and then I think I've made more than medium wage, and we'll go over to Rumble so that we can show you my new music video called Verena. Oh yeah, I've made more than medium wage. Good job, chat. Good job.
Yay.
Let's see.
wanted
Where
to
was
do
I
video.
at? Someone put him in the Blue Oyster. We looked that up. Jameson says, thanks for the 2. I have an idea for Jameson's birthday present. Puzzled Puzzler, thanks for the 5. I'm not a pathologist, but I did stay at a Hotel Inn Express last night. Jameson, thanks for the 2. Police Academy movie reference. It's the gay bar.
I knew it sounded familiar.
Jameson birthday, it seems the chat is in October. And by the way, Jameson, I did get your email about that. I think I think the best thing to do is to keep giving to the Timms fundraiser, because then they can take him wherever they want to for his birthday.
Yes.
And that would be the best thing to do, is to just keep giving to that fundraiser and get them to their goal so they can go on their vacation that they so want to go on. Puzzled Puzzler, thanks for the 5. His sole job is to find instances of child A. He's a hammer and is paid to be a hammer. So what will he find? Well, I think the answer to that, chat, is nails. That's right. If you answered nails, you are correct. All right, guys, we are going to go to Rumble. Who's got the Rumble link? Let's see. Rumble. I don't have Rumble up right now. Yes, I do. I had it because I was just looking. There it is. Okay, here's the link. I am dropping it in the chat right now. Those of you who have never been to Rumble, it is free. Do not give your credit card to anyone, okay? People say this all the time. They're like, I tried to go, but I didn't want to put my credit card in. You don't need to put your credit card in to go to Rumble. And if you're getting that, you're on the wrong link. Open your browser, put this link in your browser, and just go there. It's free, just like YouTube. It is exactly like YouTube. It's just on another platform that doesn't censor us and treat us like small children who can't be trusted with anything, with sharp things. You know, it's a place where we go to do whatever the hell we want. So those of you who are here need to run over to Rumble right now. Let me see if the numbers are popping up on Rumble. Come on, Rumble. Where are you? Only 10 of you have gone over to Rumble so far. I don't believe it. Come on, get over to Rumble. I shall pin it to the top of the chat, and you guys need to get over there and do that now, or you're going to miss the Verena music video. So if you want to see my new music video, you got to go over to Rumble. I am putting it in the description of this video for the replay crew. I am placing that. There you go. It's now in the description of the YouTube video. Head on over to Rumble right now.
You know, I slightly believe that they might take this music video back to their club and use it as their like new anthem. I'm slightly scared of that. Yeah.
Well, that is
like
a possibility. That is a possibility that the Hellfire Club will start using it because it makes them happy. But let's see. Where is Verena? Here she is. Okay. I'm ready to go with the music video, but you guys got to get over there to Rumble. I don't want to play it before you all get on over there. How are we doing on the... There are still... Let me check. Let me make sure you guys have all gone over to the dark side. I'm wearing the appropriate hat for it. All right. I'm giving you just a few more seconds. Once the Rumble video stops playing, we will be off of YouTube and only on Rumble. So make sure that you get over there. If you've missed it, I don't know what to tell you. I've given you every warning I could possibly give you at this point. And I'm done warning you. So here we go.
Ladies and gentlemen, let's get